Good morning, everyone. Welcome to the Council's Tuesday, October 26th session. We have one proclamation today recognizing National Employment Disability Awareness Month by Council Members Glass, Council Vice President Albornoz, and Councilmember Rice. Councilmember Glass.
Good morning, Mr. President. Good morning, everybody. I'm excited to be here this morning to celebrate National Disability Employment Awareness Month and to recognize the 85,000 Montgomery County residents who currently live and work here with a disability. And I see everybody has popped on to our Zoom. Good morning to all of you, incredible leaders and advocates. Since the passage of the Americans with Disabilities Act 31 years ago, we've continued to make progress here by extending access to employment and community involvement to more and more people with disabilities, helping them, helping their friends, and of course their family as well. And Montgomery County has an incredibly strong network of local organizations that are working every single day to provide job training and job placement and other support services, wraparound services to the thousands of our friends and neighbors and loved ones who are experiencing some sort of disability. And I am pleased this morning to be joined by my HHS colleagues, Vice President and Chair Albornoz, Councilmember Craig Rice, and our dear friend, District 3 Council Member Sydney Katz. And all of us have an incredible passion for this work and creating opportunities for everyone to succeed so that they have fulfilling lives. And there are so many organizations here in Montgomery County that it was hard to whittle down to a Zoom already this large. But I am so pleased that all of you are here. And in a few minutes, we'll hear from each of you briefly, but just wanted to give a quick shout out to Sunflower Bakery, Up County Community Resources, the ARC Montgomery County, D-Treatment Learning Center, Red Wiggler Farm, Transcendence, and the Caroline Center. And so as these organizations continue to lead the way, we are incredibly proud to have you based here in Montgomery County and doing work for all of our residents. And it's not only the work that you do, but it is incredible partner organizations like Dawson's Market and Giant and other retailers and grocers and restaurants who partner with you to help all of us in the community. And it is wonderful to see. And so with that, I would like to introduce Council Vice President Albornoz to make some comments.
Thank you, Councilmember Glass. Well said, and it's an honor to join you as well as Councilmember Rice to provide this really important proclamation. And as I look out into the Zoom audience here, I see some of the most remarkable leaders that we have here in Montgomery County, representing some of the most special organizations we have here in Montgomery County. And I want to thank in particular all of you for your dedication and your leadership. Each of you have had to pivot in ways that you could have never imagined since the beginning of the pandemic to provide support for not just the clients and the families that you all serve, but for your own staff to take care of them holistically and emotionally during what has been an emotional time. And I love the theme of this year's Employment Disability Awareness Month, which is America's Recovery, Powered by Inclusion. And nationally, we know that more than 1 million people with disabilities lost employment during the first 6 weeks of the pandemic. And we know how COVID has disproportionately impacted our residents with disabilities in a variety of ways, and tragically from a health perspective as well. But we are so fortunate to have such great nonprofit organizations who lead the way in letting everyone know the benefits of having these remarkable individuals join us in the workplace. There is a dignity that comes with receiving a paycheck. And there are skills that every single one of us has and can contribute to our society and to our economy in so many different ways. And so I encourage all of our businesses out in Montgomery County and in our region to please work with these incredible organizations and families and find employment that everyone will benefit from, especially, frankly, the employees themselves that have the opportunity to work alongside with these remarkable individuals. So it's an honor to join you all this morning. And I yield back to you, Councilmember Glass.
Well, thank you very much, Mr. Chair and Vice President. Well said. Councilmember Craig Rice, dual hats of also HHS and chair of the Education and Culture Committee, important for this conversation.
Well, thank you very much, Councilmember Glass, and I want to thank my colleagues for all of their remarks. And I want to address what it means to the individual. And I want to start off with a couple quick stories. One, which is my chief of staff, who was diagnosed with ALS and towards when the disease progressed, became disabled, had a wheelchair. The most important thing, we heard this from his widow, was that he was able to still come to work. We made accommodations for him, and that's what mattered to him in his last days, being a part. And it means something for all the people who you, our nonprofit partners, continue to employ, because that's what they want. They want to be included. They want to be a part. They want to feel as though they matter. They want to feel as though they're not separated from anybody else who looks just like them, but may have a little bit of a disability or some sort of a learning challenge or some sort of a physical disability that kind of gives them some sort of a challenge with some tasks. But the reality is that there's still so many things that they can do, so many things. And we need to make sure that we're continuing to provide those opportunities because it matters so much to the individual. We're lifting up people of all ability levels and allowing them to play a part in our community, in our society, in our world. Isn't that what we're all about? Inclusivity, about making sure that people realize just how important they are. When we strive for diversity and inclusion, it really is something that should be found in the workplace. And what a great model it is for young people, our young children, to be able to see adults like them who are in the workforce that we can showcase as examples. We always talk about, the diversity of teachers and the diversity of people in our workforce, primarily of color. And we say, look, it's great to have a Black teacher. It's great to have a, teacher of Latinx descent. These things are great because it gives folks examples. Well, it's also great to have people in our workforce who have differing abilities. Because for those young people who then can look and see and say that my future is bright and I have something to look forward to, is just incredibly important. And so I just really want to, again, thank each and every one of you, because I know that you wear your heart on your sleeve, that you do it because it matters to you personally and because you know how much it matters to our society as a whole. And to the companies, from Hot Breads to Marriott, from the smallest to the absolute largest, thank you to all of our corporate partners who continue to make sure that everybody understands that accessibility matters. Thank you, Councilmember Glass.
Well, thank you, Councilmember Rice. I think that should be a title of someone's memoirs, From Hot Breads to Marriott. I love it and love everything that you said. And we are all committed to making sure that everybody in our community continues to have access to the jobs, and especially the changing nature of jobs as they become more digital and as the types of education and skills needed for some of these jobs evolve. We're going to be here making sure that you all have the support and the resources that you need as we continue to progress as a community. And so in no particular order, we'd love to just hear briefly from each of you. And first off, I'd love to hear from Jody Tick, the Executive Director of Sunflower Bakery.
Good morning. Thank you, Councilmember Glass and the rest of the members of the Health and Human Services Committee for recognizing Sunflower Bakery today as part of the Montgomery County commemoration of National Disability Employment Awareness Month. Sunflower enables pathways to employment, as we've been discussing, for people with learning differences through workforce development in pastry arts and hospitality. And since our inception in 2010, Sunflower has impacted the lives of more than 460 individuals through our employment training and job exposure programs. And last year, we had an employment placement rate of 70% and have developed partnerships and relationships with over 60 local employers to place our well-trained graduates. Sunflower continues to respond to the growing demand from employers and students, especially in this era of COVID-19, and we will continue to enhance, evolve, and expand our programming to meet that need. Thank you again, and we look forward to continuing our partnership with the county.
One of my favorite bakeries. Thank you very much, Jody, for you and all the work that you do. Next up, another friend of the council, Jenny Lynn, the Executive Director of Up County Community Resources.
Hi, everybody. Good morning, and thank you for this honor. It's so nice to be recognized, knowing that we're probably the smallest nonprofit on this call. Yeah, the pandemic did put us into quite a tailspin because we like to do all of our programs in the community. We feel like inclusive training is mutually beneficial for the community to see the potential of our members and for our members to learn appropriate behavior skills and job skills in the community where they can see their neighbors and have their neighbors see them. And it was really hard during the pandemic to do that, so we did pivot to a one-to-one training, and now some of those folks have been able to move into the group training, and but there are just some members that still need that intensive work. And while we can't guarantee that everybody is going to get hired right away, we just want to equip and empower our members with skills that they need to be successful in whatever business they would choose. Their version of success is different than mine and is different from their parents. So we're really just trying to find the skills that make them happy and equip them for a fulfilling life. So I'm really thrilled to be here. We're only 7 years old. I think I've been around for 6 of those years. And it's an honor to be called a friend of the council. So thank you very much. And I think I get bonus points for joining from 39 degrees in Wisconsin in a cemetery, because I had to go on a hill to find a signal out here at my in-laws' house. So
Well,
I may drop up early. I'm freezing.
Thank you for joining us from a hill in a cemetery from Wisconsin. Lot to unpack there, Jenny, but thank you very much for taking the time. And so from one of the smallest organizations amongst us this morning to one of the largest, the ARC Montgomery County, I'd love to introduce Daria Cervantes, the Chief Executive Officer of the ARC.
Good morning, everyone, and thank you so much for the honor of being part of this proclamation today. The ARC Montgomery County's mission is to connect people of all abilities and all ages to build fulfilling lives. And nothing helps people build a fulfilling life like a job does. Aside from the monetary benefits of having a paycheck and the freedom that buys for people, the ability to form relationships, gain new skills, and be able to go somewhere when somebody says to you, "What do?" You have an answer about what your job and what your career is, brings so much meaning to the lives of the people that we support. During the pandemic, many of the people that we support in employment actually were essential workers. So they were back to work relatively quickly, as were the staff people who support them. So it was challenging, but it was rewarding to see that people with disabilities once again stepped up to the plate when they were needed. So thank you for this opportunity today. We value our partnership with the county, and we certainly value our partnership with many of the colleagues I see on this call, some of whom I haven't seen in years at all, let alone in person. Looking forward to when we can get back to that. So thank you so much for this proclamation today.
Well, thank you. And we do what we can these days to get everybody in the same Zoom where it happens. And until we get to see each other personally, this will do for now. But thank you, Daria. Next up is Dr. Patty Ritter, the Executive Director of Treatment Learning Center, another great organization.
Hi, thank you. Thank you to the Montgomery County Council, HHS Committee, for recognizing National Disability Employment Awareness Month, and TLC, the Treatment and Learning Centers. It's a real honor. For 70 plus years, TLC has been meeting the unique and diverse needs of the community, including supporting transitioning youth and helping adults with disabilities find and keep jobs. Not only does employing an individual with disabilities support community inclusion and increased independence for the individual, but more importantly, it provides a diverse workforce and a valued employee, which makes good business sense. I would like to extend a special thank you to our TLC staff and all of the individuals who work hard to find and support the right employment opportunities. Thank you again, and we hope that this recognition will raise awareness and result in even more jobs in Montgomery County. So thank you.
Amen to that. And also thank you for the shout out to all the supportive staff and board members and everybody else who makes this happen. So thank you, Dr. Ritter. Next up, another friend to many, Woody Woodruff, the Executive Director of Red Wiggler Farm, one of my favorite farms in Montgomery County.
Thanks, Council Member, and good to see everyone this morning. Red Wiggler was founded in 1996, 25 years ago, to create meaningful jobs for adults with developmental disabilities. Our mission at Red Wiggler is to be a sustainable farm where people with and without developmental disabilities come together to work, learn, and grow healthy food. And during the pandemic, we were essential workers here on the farm. Prior to the pandemic, we had 14 adults with developmental disabilities on our payroll, getting paid minimum wage or better. At the onset of the pandemic, it was just a small group of folks keeping the farm going so we could get to the other side. And slowly, we were able to bring our growers back to work. However, we paid everyone according to the schedule that we had planned for them throughout our fiscal year, which ended in September. So that's beyond the PPP money, and everyone had a chance to come to work when they were ready. What was really meaningful for everyone that works at Red Wiggler and volunteers at Red Wiggler is that during the pandemic, 50% of the food we grow and harvested was distributed to our neighbors in need through various channels. And this touches on a point of when you're working here at Red Wiggler, you're contributing to your community. And yes, we sell vegetables, but we also make our vegetables and the food we grow accessible to a wide range of people. And this develops a sense of pride for our growers. And they really have established an identity as a farmer. As Darius said, you know, what do you do for work? Our guys say they grow watermelons, or they grow vegetables, or they work on a farm. And it's just really heartwarming. Thank you all for recognizing this wonderful group of nonprofits and leaders here in Montgomery County. We really appreciate the recognition.
Well, thank you, Woody. Some of the sweetest watermelons around. So keep on growing. Next, love to introduce Laura Owens, the president of Transcend.
Oh, thank you. Thank you so much. I am a transplant from Wisconsin, Jen. So I was just in Wisconsin this past weekend. So Transcend is very honored to be recognized by Councilmember Glass and the members of the Health and Human Services Committee for the work that we've done over the past 35 years in supporting individuals with disabilities and obtaining and maintaining employment. Our mission is meaningful work and community inclusion, and that really is the cornerstone of everything we do. We work with the Montgomery County Schools, we work with the businesses in the community, and I think everybody's pretty much said it. Employment is so critical for everybody, and I am hoping for a day when we don't have to have a National Disability Employment Awareness Month, because it'll just be a natural thing to hire people with disabilities, because the reality is employment is really an economic issue, because we need everybody in our communities to work, for our businesses to prosper, and our communities to thrive. And I am proud to be a Montgomery County person now, to really support individuals with disabilities and to work with some amazing people like Pat, like Sunflower Bakery and Jody, like Uptown County with Jen. And I'd like to get to know all the other people on this as well. So thank you so much for this opportunity and this honor and recognition.
Well, thank you. And yes, we can reconvene this group for Worker Appreciation Month, whenever that might be, right? And then rounding us out, last but not least, welcome Marcus Handy, the Senior Director of Services for Caroline Center.
Good morning, everyone. On behalf of everyone at the Caroline Center, I would like to thank Councilmember Glass, and the other members of the Health and Human Services Committee for this special honor. Every day, our staff work collaboratively to embrace our agency's core values through providing supports that accomplish our overall mission to inspire individuals to work and to increase their quality of life. Our work is truly a team effort, and I would be remiss if I didn't acknowledge the many direct support professionals that provide this meaningful work day in and day out, especially through all the challenges during this pandemic. Again, thank you for recognizing our organization, and congratulations to all the other honorees.
Thank you very much, Marcus. And so with that, we can now read the proclamation. So I will start this off. A proclamation of the Montgomery County Council. Whereas National Disability Employment Awareness Month is held every October, so we can recognize the important work taking place to ensure that individuals with disabilities have full access to employment and community involvement. And
whereas our thriving network of local nonprofit organizations are committed to creating rich and rewarding opportunities for people with disabilities, while also fighting the stigma that exists within our communities at large. And
whereas we must continue working with organizations and businesses to close the unemployment gap among people with disabilities, as they currently face an unemployment rate of 11% in Montgomery County, compared with 4% of people who have no disabilities. And
whereas Montgomery County is appreciative of our critical partnerships with local disability employment organizations that are educating and bringing awareness to all residents about issues facing communities with disabilities. And
whereas Disability Employment Awareness Month honors the important contributions of people with disabilities in our community and those who support, encourage, and employ them.
now therefore be it resolved that the County Council of Montgomery County, Maryland hereby proclaims October 2021 as Disability Employment Awareness Month, presented on this, the 26th day of October in the year 2021, signed by me and Council President Tom Hucker. So thank you all for joining us this morning and for all the incredible work that you do here in our community. Thank you.
Thank you all. Keep up the good work. We will now just break for 7 minutes and reconvene at 9:30 for general business. Thank you, council members. Thanks to all of you. Welcome back, everyone. Now we'll move on to general business. Madam Clerk, could you please share announcements, agenda changes, or petitions?
Yes, good morning, Council President and council members.
Morning.
There is one announcement. The council is seeking applicants for the Charter Review Commission. The application deadline is November 15th, 2021 at 5 p.m. That's all, Council President.
Thank you. Colleagues, the clerk has also distributed the minutes to council members for the meeting of September 21st, 2021. Are there any changes? Hearing no objection, the minutes are approved as submitted. Now we can sit as the Board of Health for item 3. We will have an update from our county government HHS department and Montgomery County Public Schools. Dr. Stoddard, welcome. Dr. Bridgers, welcome. Good to see you both.
Good morning.
Good morning.
Mr. D'Andrea, Mr. Blinsky, terrific. Mr. O'Donnell, great. Okay. Dr. Kroll, great to see you. Dr. Stoddard, if you're leading this off, the floor is yours.
Yeah, I'll just start for a moment and say thank you, welcome. Thank you for welcoming us back. Very much appreciate being back to talk about all the things that are going on right now. There are a whole list that I'm going to bring up real quick just to mention, and then I'll turn it over to Dr. Bridgers to give our traditional update. So lots of stuff going on right now. You're going to hear about this morning. We're going to try and cover it all as robustly as we can. As you know, additional booster shots were announced late last week by the feds. And so we've actually been already distributing Moderna and Johnson & Johnson booster vaccinations. I'm sure Dr. Bridgers will go over the locations for that. We've obviously been expanding and working to improve the testing that's going on in MTPS. You're going to hear a bit about that. The vaccination efforts for the 5 to 11-year-olds are going to be the major focus of our discussion this morning, given that we are going to lay out our strategy. And I think the members of the public will be very interested in that. Test to stay, you're going to hear, I will tell you, you're going to hear about that this week. We're going to make an announcement later and start over the next few days, just to make sure we're clear on that. And obviously, I know we're going to talk about employee testing as well. So just highlight those 5 things we wanted to cover with you this morning. Got to have updates on all 5 things, and figure the conversation will be very robust this morning. So with that, I will turn it over to Dr. Bridgers to sort of start us off.
Good morning, Dr. Stoddard. Thank you for that transition. Good morning, Council President Hucker, Council Vice President Albornoz, and all the council members joining this morning for our discussion as council sitting as the Board of Health. A couple of points, about 4 that I wanted to share prior to Mr. O'Donnell running through a very comprehensive 5 to 11-year-old pediatric vaccination planning. I've asked them also to include some of our booster planning, specifically to look at those categories that we've had many questions about, our immunocompromised classification, our underlying health conditions or chronic conditions that were recently and or previously approved. And lastly, those occupational exposures. So we have all of that detailed in a PowerPoint presentation that Mr. O'Donnell will go through, as well as our pediatric planning and where we are. As a reminder to all, we've been planning for this since July, along with our booster shots and our 3rd shots. And so we have leaned on our lessons learned and communication and what the data and science have taught us thus far to build our infrastructure and capacity. With that said, a couple of points. I received a health officer memorandum yesterday regarding the Magellan Diagnostic blood lead test. These tests are being called, so this is an alert message to all of those providers who either are pediatricians or obstetricians who use these lead tests in the field. They've been recalled. The number, if you have any questions about whether or not you should still use it or any challenges or what the FDA recall is all about, please contact the Environmental Health, the Department of Environmental Health helpline at 866-703-3266. Next point I'd like to discuss is our flu clinics. We still have flu clinics. We are heavily into the flu season. We have them posted. I can post it during this discussion if needed. It's posted on our websites. As a reminder, based on our data that we've collected from 2017 to 2019, flu and influenza and respiratory illnesses associated with flu-like symptoms was the number 7th leading cause of illness and death in the county. Third point is there was an incident last week, and we understand that we've made many changes and we've developed and established trusted places and respectful places, which was a key message that was shared with me and Dr. Crowell during a town hall session earlier last week regarding our spaces. And we respect our community, our citizens, for those who come out to these trusted spaces to receive their vaccines, their booster shots. We are still vaccinating individuals for their initial series because we still have some unvaccinated individuals in the county. For those individuals who are seeking to receive a 3rd shot, if they're immunocompromised, or a booster shot that's been recently approved. And we recognize that there were some issues regarding the interpretation or the intent. Let me be clear, if you self-attest that you are immunocompromised, or if you have an underlying health condition, or if you are at greater risk for occupational exposure, we will honor that self-attestation and administer a booster or an initial series shot to you. Documentation is used to confirm the identity on your vaccination card, not to attest to or confirm any citizenship. That is not the cause of asking for an ID. Even if you don't have an ID and you come in, we will reissue an ID and put you in the system. We use the state system, Immunet, as well as PrepMod to determine any previous shots. So I just wanted to be clear on that. If you visit our local health department site, there are over 215 sites in the county. If you self-attest and if you received a booster, you will receive a shot. Our goal is to vaccinate all of those who desire to receive a shot and those who are unvaccinated. So that's the intent. The third piece is we've had many discussions and much conversations around the Board of Health regulations, mask mandate, and its intent. I sent forward notification last Friday that as of last Thursday, we had reached the threshold to determine and monitor for 7 consecutive days that Board of Health regulations. I asked the Board of Health during this time if we simply have a discussion to clarify that intent. I'm sure any concerns regarding when the 7th consecutive day will end, be it Thursday or Friday, based on the Board of Health's intent, can be remedied during this discussion. There is still concern regarding, as CDC has reported, and continue and strongly encourage those individuals who are unvaccinated to wear masks indoors. We still have about 95 to 150,000 young folks, 5 to 11-year-olds who still need vaccinated. And we are proactively, earnestly, energetically planning to vaccinate them, hopefully during the second week of November, if not sooner. There's still a need for us as adults, as family members, parents, guardians, and siblings to model that behavior that demonstrates to those individuals who are unvaccinated, those 5 to 11-year-old individuals, the efficacy, the effectiveness, the preventative need to, as a layer of protection for individuals to wear masks until they're vaccinated. And so I'm sure that we can come to a consensus during this sitting as a council of the Board of Health to remedy any issue. If it ends Thursday, I'm fine. We still continue to encourage and strongly recommend that those individuals who are unvaccinated wear masks indoors. That's all I have as far as the initial updates. I turn it over to Mr. O'Donnell unless Dr. Kroll has any opening remarks so that we can continue to present our plan to you and receive feedback. Thank you.
Thank you, Dr. Bridgers. I'm now going to share my screen here so you can see some of the data that we have. So the latest data from today, our case rate for the day was 6.49 daily cases. This comes out to a case rate per 100,000 of 45.4. This was from yesterday's data. So that marks the 5th consecutive day below 50 cases per 100,000. Our test positivity rate continues to drop. It is now at 1.36. And both of these are in, well, that is in the low transmission category, and the case rate's in the moderate transmission category. So per the CDC guidance, we go with the higher one, which means we've been 5 consecutive days in moderate transmission. Sharing the additional data from the most recent pulse report, we continue to provide both first and second doses and now an expanded range of booster shots. We are now able to provide booster shots to any residents who have completed their previous set of COVID vaccinations, including the Johnson & Johnson vaccine, a single dose of that, or 2 doses of Moderna or Pfizer. We have given over the course, since Friday when we were first authorized to give boosters, we've now given over 600 booster shots since that point alone. So it is making up a majority of folks coming in. We're still strongly encouraging those individuals who have not completed their primary set of vaccinations to please come in and get those. We continue to track on where folks are vaccinated and where we need or where we have below average rates of vaccination. We'll touch on this a little bit more in a few minutes as we talk about our plan for rolling out vaccine to the 5 to 11-year-olds. And we continue to also see, while those vaccination rates are becoming more similar between our racial and ethnic backgrounds, we continue to see a now slightly higher hospitalization rate for certain ethnic and racial backgrounds, including our Black, non-Hispanic, and our Hispanic and Latino populations, slightly higher than our white non-Hispanic. So going into the guidance on booster shots, we know that with 3 different vaccines, and different eligibility criteria. It has been a little bit confusing previously. We're hoping that it becomes a little more straightforward now. Again, if you've completed your primary set of vaccinations, you meet one of the following criteria, you can get a booster shot. For Johnson & Johnson, it is only a 2-month time period between having one dose and qualifying for a booster shot. And everyone who got that first dose, as long as they're 18 and older, qualifies for a booster and is being recommended to get a booster. Johnson & Johnson's only right now licensed for 18 and older under the EUA. So it would be anyone who's gotten a Johnson & Johnson vaccine at least 2 months ago is recommended to come in and get a booster. And they can get any one of the boosters that's available at the site they go to. The Moderna eligibility now is the same as the Pfizer, which is once you've completed 2 shots and it's been 6 months since your second shot, and you meet one of the following criteria. Any resident 65 and older is recommended to get a booster shot. Residents 18 and older with either an underlying medical condition or an increased occupational or institutional risk. And that includes living in a long-term care facility or participating in an occupation that puts them at greater contact with the public. Those occupational risks, those underlying medical condition risks have not changed. But again, like the Johnson & Johnson, if they're eligible for a booster, they can get any one of Pfizer, Moderna, or Johnson & Johnson. Again, with these conditions, which I'll share again, just as a reminder, we have them on our website. They're on the CDC website as well. We don't ask for any specific documentation that you have the condition or that you work in this occupation. You just need to let us know that you do, and then we'll provide that booster. For the immunocompromised, it's a little different. It's a shorter period from completing your prior vaccination. It's 28 days. And the list of individuals who are considered to have compromised immune systems, I'm sharing with you right here. It's also, again, on our website, on the CDC's website. And again, we don't ask for any documentation, just that an individual attests to having one of these conditions. And then they would be eligible for an additional shot. One thing to note is with the boosters, the Moderna booster shot is a slightly different dosage. It's a half dosage compared to a third dose for an immunocompromised or a first or second dose for individuals getting that. And any place where we have Moderna, we're able to give either that half dose booster shot or the full dose for first, second, or immunocompromised. Moving on to the pediatric vaccination updates. Again, to remind folks, the FDA is scheduled to meet today to review the Pfizer safety and efficacy data. And then the CDC is scheduled to meet next week on the 2nd and 3rd to review the data that the FDA has provided and the recommendations that they have provided. That means it is unlikely that we would have an authorization before the 3rd. It is possible on the 3rd. It is also possible it's some later date. We, as a county, have placed orders with the state for the pediatric version of the Pfizer vaccine. We've been advised that we are not allowed to use the current adult formulation. It will come in a new formulary, and it will be distributed out to health departments, pharmacies, pediatricians, other providers. So we are still waiting to learn whether that will arrive before the authorization or not, which could affect, the timing of us expanding our clinics to 5 to 11-year-olds. We do expect that there will be a lot of information coming out through the media and through our federal and state partners about how to administer this and the other guidelines. So we'll pay close attention. We know it's sometimes confusing when the FDA has authorized something, but we still are waiting for the CDC to authorize that. Our state partners have said once they get that CDC authorization, the state authorization will follow almost immediately. So we don't expect there to be a delay on that. To remind folks, what we're recommending is that we'd like the our 5 to 11-year-old residents to be vaccinated as quickly as they can. And so we are encouraging people to look at all of the options that are out there. There are lots of private providers who have signed up and are already giving COVID vaccine. We know there are hundreds of pharmacies in Montgomery County that do that as well. And then, of course, there are our community clinical partners, our primary care coalition clinics, as well as our public health clinics. There is a really useful tool that we link to on our webpage that is also on the state webpage that helps you find the closest place where a vaccination can be given. And it also gives you information if you're looking for a specific vaccine. Our call center, again, is happy to help people navigate this and figure out the best place to get vaccinated if they don't have access to these online resources. So within our county strategy, again, our goal is to increase accessibility. We know that that 5 to 11-year-olds will need a parent or a guardian to be with them when they get vaccinated. And so we're looking to increase our hours that make that more accessible. We'll be increasing our weekday hours to include more evening hours, and we're going to expand the number of sites we're at on the weekends, including working with MCPS to identify school sites and to do communications through the schools. We also routinely monitor the demographics of vaccine uptake to figure out if there's discordance in the geographical, racial, ethnic, or other disparities of who has access to vaccine or who's getting vaccinated, so we can focus our resources on those areas that need assistance in getting vaccinations. We're also coordinating with transportation partners to, again, make this more accessible. We do know that a high number of community providers are giving vaccine, as we've said, across the country. More than 70% of those providers who traditionally give vaccine for children and are enrolled in that federal program have already signed up and been giving vaccine. We've seen that we had great success working with MCPS in communicating out to the families that are part of that system, and it's helped to bring in additional people to our site. So we'll continue to do that. We do think there will be a significant demand over the initial few weeks. As the state has outlined it, they believe there's two sets of individuals, and this is boiling it down a little bit more simple, but they believe there's constituents who will seek a vaccine, and there's constituents who will allow their child to get an easily accessible vaccine. With the next chart I'm going to show you, it's the 12 to 15-year-olds and the timeline of getting vaccinations to the 12 to 15-year-olds in our county. And you'll see our county has many, many more people who fall into that will seek a vaccine for their child. So to show you how this rolled out back in from May through at least August, and the data has continued in a similar fashion since August. But you can see there's a tremendous number of people who came out almost immediately. And you can see as we've broken this down by our different racial and ethnic groups, they came out in every population within our county very, very quickly. And then they continue to come out over time as well. So we are preparing for a large initial demand. Some things have changed since we rolled this out in May. At that point, pediatricians did not have access to vaccine. They do now, which certainly will help, as well as just increasing the number of sites and the number of people who have access to vaccine. So in working with our county partners, we focused on increased strategies to ensure that vaccine rolling out is equitable. Knowing that the private providers have increased access to vaccine shifts the focus at the county level to ensuring that there's equity for all of our populations in the county. And so, again, we want to increase access for those areas that have traditionally lower vaccination rates. We want to increase access based on disproportional impact to racial and ethnic groups. As we mentioned earlier, even when vaccination rates are similar, there's still greater impacts to some of our populations. We also are looking at zip codes with higher case rates And so these last 2 points were some of the basis of our equity framework when we initially rolled out to the county. So we're going to continue doing those things. We also want to increase opportunities to reduce disparities that we may see over time. And again, coordinate transportation and health resource access to increase opportunities for vaccination. So as I mentioned earlier, we do look at these charts. I've outlined a little bit here so it's easier to understand where these are. This is where our case rates are higher. As you know, we've been working as a county to be under 50 cases per 100,000. So these are some of these are significantly higher. Some of them are modestly higher than those rates. But we'll look at where we're being impacted by higher case rates. We're also looking at where our remaining lower than average vaccination rates are. And so when we do that, this has impacted our day-to-day where we have our county sites that are currently running anywhere from 4 to 7 days a week at our primary sites. And then our second sites are usually a day or two a week in addition. And these line up with where those other sites are. And I'll share an overlapping graph in just a second that shows you how those pair up. And looking at how we can expand that out on weekends, working with MCPS, they've identified a series of locations that will help us get to a greater number of populations and make it more accessible. And the way they did this was they started with the 37 Title I designated schools in our county, and then they developed clusters for those 37 schools and identified a middle school that could serve as a hub for those clusters. And the reason we picked middle schools is they tend to have greater logistical resources at them, more parking for people coming, and more accessibility internally than some of our elementary schools are. So we've worked to identify 9 additional hubs for the weekends. And again, these are stated as proposed because we don't know exactly the day that this will be authorized, but right now these are the sites that MCPS has identified and works well with those areas of need as well. We shared those previous 2 graphs of the impact to the county and the way these overlap with those. I will come back to that mapping in just a second, but I want to outline the 2 other parts of our plan. One is increased transportation access. MCPS is coordinating bus service to those sites on the weekends to transport families to the designated sites. And we're continuing to work with them on the details of that service. We'll include it in our public messaging as well. We're also working with DTS on supporting that effort, and we're linking together with MCPS to have a cohesive strategy. DTS has in the past updated some of their ride-on routes to ensure that individuals can get to vaccination sites. There are also additional transportation services that are more one-on-one for individuals who are over a certain age or have disabilities, both connect-a-ride and call-in-ride work. There's also the Medicaid non-emergency medical transport, which is available for qualifying Medicaid members. And then we are actively working on our communication strategies. MCPS has developed a couple campaigns. I'm sure they can go into this a little bit more on their presentation, but they've developed campaigns both for the younger students, the kindergarten through 3rd grade, and some of the slightly older students. They'll be handing out materials that will go home with the students and posting up flyers in the community. They'll also be developing some PSAs that will be put out there. Our PIOs met yesterday at the county level and have similar strategies that they'll be implementing to make sure that this covers not just the public schools, but both public and private, and go out to a range of social media platforms. And again, just sharing some of the materials that MCPS has developed, and including, I believe, stickers that will be handed out to the students as they get vaccinated. So I just wanted to share one more thing, and looking to change the what I am sharing here, if I can. All right. And I just wanted to show you how we worked with MCPS to determine these sites. As we mentioned, we looked at the higher case rates. We looked at the below average vaccination rates, and we looked at where our county sites are, and they have mostly, as you can see, been selected to be in areas where we have lower vaccination rates to make it easier for our populations to come on and be vaccinated. And then, as you can see, when we add in the proposed public school sites for the weekends, again, we're looking to be in those areas that have been most affected by COVID. That's all I have for you today, but I'm happy to answer any questions.
Thanks, Mr. O'Donnell. I'm really glad to see all those pediatric sites. That seems like a real improvement and responsive to what we've been asking for quite a while. Sorry, is that everybody? We can take questions, I guess, like we did last time for HHS first and then MCPS. Mr. D'Andrea, you have your own presentation, right?
Yes, we do have a very brief presentation.
So
back next Tuesday.
Thank you. We're looking forward to that. So I'll just let colleagues jump in now. Councilmember Rice.
Thank you very much, Mr. President. And Dr. Bridgers, Dr. Stoddard, Dr. Kroll, let me just tell you that the system's working well in terms of folks signing up for boosters. I got my shot yesterday at Montgomery College, Germantown. My original shot was of Johnson & Johnson. I got the Moderna booster yesterday because of the 76-fold increase. You know, you can't step away from those sort of numbers. So certainly wanted to make sure we got that. A little groggy and a little sore, but still feel great. And I'm here. And I actually ran into our chief, and I actually asked him if I could say so, but I ran into Chief Goldstein as I was walking out. He was coming in getting his booster shot. So it's good to see that our public safety folks are getting their boosters in addition to their original shots as well. And my mother got her shot earlier that day. So the process is working. It was very busy. There were lots of people that were coming in, and it worked effectively and efficiently. And so I just wanted to make a little public service announcement for, as Councilmember Duando says, the millions that are watching at home, to please go and get your boosters if you're able to do so. And you qualify based on the certain circumstances. Because I got Johnson & Johnson, I was able to do so. My mother, who's over 65, I won't say how old she is. I got in trouble last time I did that. Got hers. And so from that perspective, look, folks are getting it done. And I saw myriads of people, seniors, as well as others who were in there getting their booster shots. And so that's really exciting to see. I will just ask as far as data goes, and I think I had asked about this before, the 5-digit zip code numbers are great. But the additional 4 actually allow for us to drill down even tighter into neighborhoods. You know, for example, when you look at some of these zip codes, they're very large. And it really is a lot better for us to get into a little bit more of the weeds there to know what neighborhoods we're talking about, what different various communities we're talking about, versus having that very generic 5-digit zip code. So I would just ask that if we can get that data, that's great. When it comes to the child rollout, let me just say that, again, for the 5 to 11 sector, that's one thing that's been a tremendous concern. There are plenty of parents out there who are ready for their children to be vaccinated. It helps to alleviate some of the fears that they have. And so from that perspective, the more that we can do in helping to partner to be able to make sure that that information gets out there to all of the different cohorts, the better. And so I know that your PIOs are going to be doing this, but I just want to remind you that all of our hubs, Por Nuestra Salud, y Bienestar, all of those, African American Health Program, Asian American Health Initiative, LHI, we all have to play a role. And in all of the various, whether it's Montgomery Cares and others, all those touch points, Montgomery County Coalition for the Homeless, all of those things, because many of those people who are experiencing homelessness have children. And so from that perspective, working with those partners to be able to make sure that we can outreach, not assuming that all the regular channels are going to get us to some of those who need it the most. And so just wanted to put those things out there as thoughts and suggestions for folks. I think we're doing a great job. We see it from the numbers. We see it from the caseloads that continue to decline. It's exciting to see that we may be in a place where we've determined a factor that means that folks don't have to wear masks, and it's not required. I know that some businesses will still elect to do so, and I know some individuals will still elect to do so. And so I just want to remind public that's out there that when it comes to these kinds of things, businesses still have the right to choose what it is that they want to do regarding requiring masks in their establishments, and people will still choose to wear masks if they deem so. So from that perspective, let's make sure that we're all working together to help support one another through this as we get hopefully close to an end. So that's it. Thank you, guys. Appreciate all of your hard work.
Councilmember Rice, good morning. Good morning, everyone. Just wanted to weigh in a little bit about about some of your comments. One is that the data that we collect and are using is the same comes from the same sources that we use to build our initial equity framework for vaccination and testing. And we have that and can track that, continue to track that data down to the census tract level. So it's not just the 5+4, it is down to sometimes within a matter of blocks. So we can tell now from thanks to the data that we get from the state and from Immunet. The other thing is that our partners, and I know Sean touched on this a little bit in the presentation about getting prepared to vaccinate for children. We are in partnership with not just our MHIPs and our county run sites and the 217 sites that will be available for vaccination for boosters and hopefully for children, but also working with partners that have worked with us in past to get ready to do vaccination and support as part of our effort to deal with children. So outreach and vaccination we will be using and making use of our partners. And then the last one is that is to your point about masks and responsibility for masks. We're about to end the county mask mandate. Hopefully the trends continue to go in the same direction for the next several days and we don't hit a reset. We will be ending that mask mandate. But CDC is still recommending masks be worn indoors and that people take precautions. We're in the middle of flu season, as Dr. Bridges pointed out, and we are about to enter this Saturday into a run of holiday seasons where there will be festivities and gatherings and increased potential exposure. So folks want to ask folks to be sure. I want to ask council to make sure that you prioritize messaging that people remain masked and be guarded and on their guard. This virus is still with us and it is still sneaky. And we have a number of unvaccinated folks, small number in this county, thankfully, but a number of unvaccinated folks who are at risk, both of contracting the virus and of spreading the virus.
Dr. Kroll, can I just, and I apologize, Mr. President, but you actually bring about a very good point, because we gave recommendations last year when it came to the holidays and having family that are visiting, those kinds of things, people that may be visiting. What do you suggest people do when it comes to that? When it comes to folks who are going to be visiting your household regarding masks, regarding vaccinations, vaccination status, all those kinds of things? For you or Dr. Stoddard, I see he unmuted as well.
So I'll start out and Dr. Stoddard can join in around that. But I think certainly the precautions, the calculus has changed, obviously, because we now have vaccines in abundance and a lot of folks vaccinated. But I think it is still important to know the vaccination status of people who are coming to your home. And to make some decisions about how you gather and what you want to put in place in terms of safety precautions, the number of people who are invited to your home. My family's thinking about Thanksgiving gatherings now and still in a position, because I have family members who are unvaccinated, of limiting the numbers of total folks that we have in a gathering and including making some decisions about where we want to gather based on what we know about the virus and the status of our family members. So people who have to exercise some caution and understand exactly what's happening with the people that they're inviting into their houses for the holidays.
The other piece I was going to add to what Dr. Kroll said is the other resource we have available to us is a much more robust testing capability, not just in the county, but also through rapid testing that you can have in your own home. And so the other thing that we certainly, and I talked to Dr. Bridgers already about this, is for in advance of particularly the Thanksgiving holiday, as Dr. Kroll alluded to, encouraging people to do testing either through the county sites or through, they can do it in their home with rapid tests as a way to, whether you're vaccinated or not, confirm your status, because, by that point, there will still likely be many younger people who are still not fully protected by the vaccine. And so obviously it seems like you don't want to have if you can avoid it, you don't want to have Thanksgiving be the source of infection at the 11th hour when we're so close to getting the young people more fully vaccinated. And so I think obviously we'll be in our messaging this year, we'll certainly be also heavily recommending the use of increased testing capability that we have in the country and in the county.
And the last thought about that is that if folks are traveling and going somewhere else for vaccinations, going for holidays, going to other states or other parts of the county, other counties, understanding what the transmission rates are in those areas, especially in other states and places that you're going, so that you can at least be aware of elevated risk. We're at incredibly low risk here in the county, and as a national leader in this, we're incredibly low risk. But that doesn't mean that other places are equally so. So you don't want to carry any kind of attitudes or make any kind of assumptions based on where we are about where you're going. So you need to check that.
So there's one last piece I'd like to add to both what Drs. Kroll and Stoddard indicated, as we've had many conversations about this. But there was an article that I shared back in June, and it was entitled, "Does My Unvaccinated Child Still Have to Wear a Mask When the Rest of the Family Doesn't?" It's published in healthychildren.org, and it goes back to my opening comments. We still should model those behaviors within our families and among our friends, especially when it pertains to our unvaccinated 5 to 11-year-olds. So even though we may not have to wear a mask, we are vaccinated, we're fully vaccinated, we received our boosters, they aren't. And so as we continue to model that behavior, as we move into November and as we anticipate vaccinating this population, I think we will continue to see those successes that have made us or got us to a point where we are now with our case rates and with our test positivity or our positivity rates.
Thank you very much. Thank you, Mr. President.
Thank you. I want to get to more colleagues, but would you mind putting the map of the schools up again?
Yes, just give me 1 minute, please.
While Mr. O'Donnell's bringing it up, I just want to also highlight that the governor announced earlier this week, I believe, that the state of Maryland has requested 180,000 doses of vaccine. There are approximately 515,000 young people in the state of Maryland. So, and I think that was a 3-week order. So just understand that that's sort of that's the pool from which Montgomery County will be, has requested and will be receiving vaccines. So it's important just to understand the context of the statewide numbers.
And when do we think they'll arrive?
It won't arrive until the state actually has the notification and provided us with the clinical guidelines, similar to the case that we received before, where we would get notification maybe on a Monday evening or Tuesday morning, and then that's when we would receive the vaccine. More importantly, Council President Hucker, we've made the request at the highest amount that we could, which was the pre-ordering of 20,000 doses per week during the first 3 weeks, which is when we anticipate that we will experience the highest volume, not only in the county, but across the state. We also understand that, and we don't know until we get the clinical guidelines and guidance, as we did last week for our boosters, how many of those vaccines will come directly to the local health departments, and how many of those vaccines, based on our allotment, will be sent to our pediatricians and or our partners. I did learn this morning that 112 pediatricians, as Mr. O'Donnell indicated, the percentage of 70% across the nation pediatricians have expressed an interest. We've received notification this morning that 112 of those pediatricians in the county have requested vaccines that may receive them directly. So we don't know how many we will get or how many the county will get based on the portion that Dr. Stoddard just mentioned.
But you've requested 20,000 a week for the whole county, and then we have to divide those up with with those pediatricians as well?
No, we don't know that yet. We anticipate that those pediatricians, as well as those partners who've received access or requested access through Immunet to receive vaccines directly to them, will not impact our numbers. 20,000 was the highest amount that we could request.
Okay, so 20,000 you think just for the county, but Dr. Stoddard was
Yes,
like
so
you
the
were nodding there. Is that
180,000
your understanding too?
180,000 that were requested by the state were for the first 3 weeks. So if you did that as an average, 180,000, that's 60,000 a week for the state of Maryland. If you look at our population as it relates to the state of Maryland, we're 1/6. So we've asked for more than our
share.
Correct.
Arithmetically, right? Yes,
correct.
Exactly, but we don't know what we're going to receive, and we don't know functionally whether we've requested 20,000, whether we'll get 15, 7, and our pediatricians will get whatever they'll get. We just don't know at this point. That's why we're laying out a strategy that allows us to scale up to whatever number we do get, but we're beholden to what the federal government provides the state, and the state provides to us.
Right. I appreciate that. It feels like Groundhog Day again. Okay, so just my question about the schools. I see the check for the field middle school vaccination sites. I appreciate what he said. Are these only at middle schools, or have you included elementary schools in the highest need areas as well?
So these are middle school sites, but they have been clustered with all of our 37 Title I elementary schools. So
you will be offering them in Title I elementary schools?
We will be
Yes
these will be serving clusters of the elementary schools. In other
I know,
words.
but will they be at the school? This is what I've been asking for, the community's been asking for 6 months. We need them at Rolling Terrace, we need them at Broad Acres, we need them at New Hampshire Estates, we need them in many other impacted elementary schools where people who don't have a car can walk there and meet with a trusted provider in the highest impacted zip codes. They're not going to be able to take a bus to a middle school that is in their cluster, but their child doesn't attend.
So Council President Hucker, this is where our community partners will come in play in those elementary schools where we already have our sites established, but we're asking our community partners to not only help with vaccination, but our rapid tests as well. So the answer to your question is yes, we can send our community partners the list that Dr. Kroll mentioned before, and I can go down the list if necessary, but those community partners can actually go to the elementary school as you indicated. So we're still building our plan, but the intent is to have our community partners be able to have access to those points. We're working with MCPS now to identify those partners so that they can get access in the school, or could they have access by way of HHS through a memorandum of understanding.
So that the school nurse in the school clinic could administer them through this memorandum of understanding? Isn't that the path of least resistance?
Yes, but keep in mind our school health services is already stressed. So we're trying to lessen the stress on our school health services. So that's why we're looking to our partners and other volunteers to go into these settings and administer vaccines to our pediatric population, because they continue to do their school health services in a non-disruptive manner. So we're planning for our partners to go in to support not only those school health services. In some cases, if that particular school health service is not stressed, then they could do it. In those cases where they may not have the staffing or the resources, this is where our community partners will be able to go in and access and administer those doses in those elementary school settings.
I realize they're stressed, and I realize there's been a difficulty in hiring, as we've discussed, and I realize we've heard from our teachers and school service employees and administrators about how much time they're having to give up in their planning time and before school and after school to do the work that they associate with HHS. So I hope you'll keep working on this. I would think this is job one for school nurses. I can't think of much that should be a higher priority. And I look forward, I know you're still putting together the plan. I think we all would look forward to seeing more detail as you put this together, because to me, this would be job one over, any kid with a cut or a sniffles.
And go ahead.
Councilmember Hooker, I appreciate why you think that this may be job one, but children who come in the building with asthma and who need their inhalers and who need to be tended to around those issues are in those immediate crises remain job one, along with anything else that comes in the door for them. We do have the nurses continuing to do testing, our staff continuing to do testing, and testing remains a priority in this process. We are dealing with multiple priorities in this, all of which have to be maintained at some level. So this represents an expansion of our existing capacity to make sure that we can get the vaccinations done. It is also our first run at this. This is our effort to get as much done as quickly as we can in as short a period of time as possible. I don't think that the school system or us or anybody else expects we will get to 100% in this first 3 weeks. We will get as close to that as we can, but there will be ongoing needs to stand up additional resources as we go forward. That's one of the reasons we're having conversations with the partners through the Healthcare Initiative Foundation and our other partners to try to fill in those gaps and add schools and add capacity as we go forward. This represents our current status. It'll continue to evolve. One of the challenges in giving you a plan is that the plan is continuously moving and continuously evolving, and you can expect that will happen throughout this process.
Okay, thank you, Doctor. That's helpful. Councilmember Friedson.
Thank you, Council President. First of all, thank you to Dr. Bridgers, Dr. Kroll, and Dr. Stoddard. I really appreciate all of your efforts. I've had lots of conversations over the last several days with you. We're trying to work through some of the dynamics. Dr. Bridgers, I appreciate your interest in collaborating and trying to understand the intent of the Board of Health and the requirement. I think it's really important. And my view as the person who drafted the initial amendment that had the termination clause was that 7 days, a plain language understanding of 7 days starts on the first day. The amendment, terminated without further action by the Board of Health when the county returns to a status of moderate transmission for 7 consecutive days. So I think the public is under the impression that that is what it means. That was the intent when it was put forward in the compromise that I appreciate all of us moving together on. I think it's really important that we are consistent in what our intention is and the way that we're communicating with the public. So I think that's important. I really do appreciate what you're saying, and I do think that there is a big difference between what we require and what we recommend. The power of the Board of Health is an extraordinary action, unprecedented action that we've been taking over the past 21 months, and I think it's been appropriate. And frankly, it has borne fruit, thanks in large part to your leadership and to Dr. Kroll's leadership, and to our prior health officers, Dr. Gale's leadership, and most importantly, the willingness of the community to step up and to do what they needed to do. And I think it's important that we, keep our, consistent with what the expectations, have been from the time that we approved that back in August. You mentioned before that how the behavior we want to model, and I've been wearing a mask indoors in public places even before August the 5th, between June and August, as a personal decision to be safe. And though there's a difference between what we model and what we mandate. And I think it's important that we be clear in our communication. We respect our residents enough to trust that they make smart decisions. They have proven time and time again that they will make smart decisions, that we stick with what our expectations that we've set from the outset is here. So I just wanted to share that there and hope we can settle that today. And I think we need to do better, frankly, and be quicker in our public communications on these issues. I think if we were going to change what a plain language understanding and what the conversation at the Board of Health publicly was to not count the first day, then that needed to be communicated with the public, weeks and weeks and weeks ago, months, frankly ago. And so I think, as we move forward, that's something that I think all of us need to do, better with, so that we're not here having this conversation now and having a little bit of confusion with different county officials having different understandings of what the requirement is. So I just appreciate your collaboration here. I think it's really important. I think it sets the right tone for what we've tried to do from the beginning, which is work together to keep everybody safe. So thank you for that. A couple just quick questions. Based on the 5 to 11, the 180,000 that we just heard, previously we had heard that the expectation is we could, if we had the doses, get 25 to 30% a week for 2 weeks. That would be 50 to 60% for 2 weeks. If you're assuming we have 100 or 105,000, it's not an exact number, but give or take, you're talking about around 30,000 5 to 11-year-olds being vaccinated a week. If my calculations were correct, if we got 1/6 of the state's 180, that's well short of that. If we got 1/3 of the states, which is sounds like what we've requested, which we can handle, and hopefully they put the vaccines in the place where they could be put into arms as quickly as possible, which has been a commitment the state has made, we'd still be, it seems, short. So I just wanted to get a sense, based on what we know now, is there any update to the 25 to 30%? Is that still what we think the capacity is, but the doses look like they're going to be far short of that? Do you have an updated expectation of what that might look like?
Thank you, Councilmember Friedson. We don't have any updates. We continue to plan for those contingencies operations that we set forth. We continue to work intentionally with our partners so that we know that wherever the doses go in the county, we can get those shots in the arms, be it our community level, our hospitals, with our partners at CVS, at our pediatricians. So we're planning for that. Again, absent of having any clinical guidance, this is what we're planning based on the census data and what we projected. As Dr. Kroll indicated, our plan is fluid, is a working draft. And as we continue to get updates and we get more accurate numbers and we can clearly present to council and the county leadership what we're getting, then we will do so. But right now it's holding at what we know and what we can anticipate and what we've guesstimated.
Got it. And the 180,000 that the state has requested, even though there's 550,000 5 to 11-year-olds, as we heard earlier from Dr. Stoddard, does that include all the private facility, our pediatricians and hospitals? I understand our 20,000, we hope, is not going to be siphoned off to those facilities. But is the state's 180,000, is there any other pipeline from the manufacturers or from the federal government to providers except through the state? How is that going to work?
Not that I'm aware of, Dr. Stoddard.
Yeah, we don't believe there's going to be a different pipeline. That's not the way it has traditionally worked with other rounds of vaccination like that. Although in the President Biden's plan, they did talk about direct shipments to some locations. It wasn't clear whether they're earmarking portions of the state allotments for those purposes or whether they're sending direct shipments to them. So we're going by the numbers the state has reported in terms of, they've said these publicly, and trying to make some estimations. But I would suspect that when we're talking about our allocation to Montgomery County, they have traditionally, when they've done these allocations to counties in the past, the state has used a holistic model, meaning what the pediatricians get, we will not get more in Montgomery County than we're entitled to by per capita than other jurisdictions would, just because we have more pediatricians asking for them. So
previously the governor and the health department counted the NIH doses and the
Correct.
Johns Hopkins Montgomery County doses and the others in the Montgomery County allotment, even though they weren't necessarily exclusive for Montgomery County
Correct.
residents.
Correct.
Okay, well that's helpful to understand. Disappointing to know, frankly, but helpful to understand. Previously, you had said that there was a chance that the doses would be received by providers. Previously, I'm assuming based on what you've said, since there's so little information, you have not received any doses. These are new doses we can't reuse. We learned a couple of weeks ago that you can't just do the pharmacist recount where you can remeasure and do 1/3. That's no longer allowed. It was thought that might be possible. So these new 1/3 smaller 5 to 11 eligible doses, when they become eligible, at least, we have not received any of those. Do we have any expectation of when we might receive them?
No, we're still waiting for guidance. Mr. O'Donnell can bring up the new packaging, but it's new packaging, new labeling, new caps for the vaccine, and we haven't received any additional information when we can expect to receive those. Once CDC and ACIP meets, then we will get notification and clinical guidance when we can expect to receive those. We did pre-order last week, which were the numbers that we indicated earlier, but as far as when we will receive them, how many we will get is still very much an unknown to all of us.
Do we have any expectation of when we plan to publish, publicly? I saw, the school sites were shared with us today of what you're anticipating, but what the outreach plan is to explain to folks, hey, here's where these sites are going to be available when 5 to 11-year-olds become eligible, community partner sites and others. Do we have an expectation for that? Are we going to wait until it becomes eligible? We're going to be able to do that ahead of time so folks can plan, particularly those who have challenges with transportation and other issues and work.
One of the challenges to this is if it's not authorized on the 3rd, the 4th, or the 5th, it could change, what some of our, the dates that we have the site. So we will be prepared to release that information as soon as this gets authorized so that people will know where to go, and we'll do it through lots of different media formats to make sure we're getting out to people. And part of why we're sharing this here is so that we can start to push out that this is our intent of where to go, but we do have to wait for that to be authorized before we can be at those sites.
Got it. Do you have plans based on that? I mean, I totally understand that challenge, but do you have plans to do a pre-registration so that we can, proactively communicate with folks so they know exactly, someone who's interested, we can say, give us your information, your zip code, and we can send information to those folks as soon as it's available of what the sites are.
So one reason we haven't gone the route of the pre-registration at this point is because there are so many different options right now to get vaccine. We did not want people to think that they were tied to going through one system to try to get an appointment. Also, and those people who said they might want to go through that system may end up finding it more convenient to go to another place because, again, we don't know exactly who will have the vaccine when it comes down to it. We remember how frustrating it was to people having to go through 5 different systems back when vaccines first came out. Different pharmacies had different systems, the hospitals had different systems, and we're trying to avoid that and make it as easy as possible for folks to get a vaccine at this point.
So Councilmember Friesen, just to add to that, we're looking at our systems again based on lessons learned. So while we may not have a pre-registration system because we know that there will be other providers outside of when we initially began our vaccination strategy back in January, where we control the doses outside of our community hospitals and our pharmacies. We will have our registration online, and we will accept walk-ups. Registration are key for us to not only manage the amount of doses we have at sites, but control crowds. And so we will be implementing that. We will be advising council and post it on our website when those mechanisms will be in place. We will have different access points for the vaccine so that we know that there was some concerns and challenges with folks who have registered and folks who are walking up being in the same line and folks not being able to register and get in according to their appointments. We appreciate that. And so those are some of the strategies that we're considering now, absent of a pre-registration process and portal.
I appreciate that. I do think, given the challenges that we had before, that a pre-registration site now that allows somebody to put in who their primary care physician is, if they have a pediatrician, indicate they don't have a pediatrician, indicate their zip code of where they live, perhaps their school or place of work. So we have some data. I think that information would significantly help us. And then since who the 112 pediatricians are today who intend to provide this, you could work with them now along with the community partners who I know you've been working with virtually around the clock, and have a better system where you can say, if you have a primary care physician, pediatrician, that is probably your best option. If you live close to these few sites, that might be your best option. And it'll be like a single point of entry, or as close to a single point of entry as we can create without the state helping us do that, which we had been requesting for quite some time. So just something to consider. If you could just give that some thought, I think we could do that now and think through what that looks like. I understand there's lots of challenges, lots of unknowns here. You're juggling your very, very difficult circumstances, and I totally respect and appreciate that. But I do think parents are looking for what to do and looking for information. And if you provide them with an opportunity to give their information now, so we can directly communicate with them the moment that this is available, they won't have to check websites and refresh at times when they might be at work and time when their kids might be at school. I think it could really help.
Thank you, and we understand.
Appreciate that. The last point and question I just wanted to raise is about the Board of Health regulation that we have in place. The Board of Health regulation is using the CDC guidelines, which is appropriate. Those are the guidelines from August the 5th. I think they still remain the guidelines unless I'm mistaken, which talks about moderate transmission versus substantial and high transmission in terms of indoor mask mandates. As time moves on and CDC guidelines we have seen change fairly quickly, and 5 to 11-year-olds being on the cusp of vaccines, we think pretty significantly in a relatively short period of time. Do we think that the standards from August the 5th that are in the Board of Health regulation will remain the CDC guidelines moving forward, or will we need to adjust that or address that moving forward? What's the expectation on that?
So my expectation is that CDC has gotten us thus far with the numbers that we have, and we rely on them heavily because they have a wider access to data points. We use that to compare and ensure that our county level data is correct. And so I think in looking at any Board of Health regulations that go forth, that we still continue to use CDC science and data as part of our planning. The other piece of that is, I think that in addition to what the science and data are saying, is that we look at where the county is as far as our protocols and processes and policies. And so having said that, I think the short answer is yes, we should continue to use that. I think we need to have clear discussions on the actual start date and the end date, which is why I referred to my opening comments. If it's Thursday and 7 consecutive days is this Thursday, then we will end at 12:01 Thursday based on the will of the county council sitting as a Board of Health. But in addition to that, the Board of Health, if I recall, mandates or requires the health officer and or his or her designee to continue to report the case rate and positivity data to the Board of Health. And we will continue to do that to provide the information that keeps the county leadership and the county itself informed of where we are regarding the transmission of COVID-19. And so I think we will remain consistent with that practice. I think we just need to be clear on the start date and the end date, whether it's the initial notification and then the when the Board of Health goes into effect and when it ends, or whether or not it starts when you are notified or we're notified from CDC, and then will it end. The last point is that we continue to monitor the data, and we know that there's a lag in data. There's a day lag in data when we report. We notify we analyze the information, and we notify those individuals who also monitor the data as well. And so having that in mind, we need to take that day lag and data reporting and analysis into consideration. So I'll stop there. Dr. Stoddard or Dr. Kroll, you can add anything to those points based on our previous discussions.
I think the only point I would say is, I think the CDC would agree with this, is that their guidance is always subject to change, meaning they could at any point change their guidance. They've given us no indication that they intend to change the definitions around low, moderate, substantial, or high transmission. And, until they do, it's difficult to speculate on when that could happen. Obviously, even Dr. Walensky, the CDC director, talked about the definition of fully vaccinated over the weekend, or I think last Friday, and said, Even that may be subject to change based on the introduction of boosters. They haven't changed it yet, but they said subject to change. So I think along the same lines, the transmission definition could change, along when it could change, how it could change. We have no idea.
Yeah, I appreciate it. I just think it's something that we need to monitor as we move forward. I know there'll be ongoing conversations about that, but we need to make sure that we're not following past CDC guidance, that we're following the latest CDC guidance, and we need to make sure that we have Board of Health regulations and any other standards that enforce and ensure that. So just look forward to continuing that conversation. I think it's the next conversation after the figuring out the end date exactly of this, which I do believe is 7 consecutive days that the Capitals win 7 consecutive games. The first game that they won counts by any plain language understanding of what that means. And so, I believe that was certainly my intent when I put that forward. Thank you, Mr. President.
Thank you. Cardinals won 17 in a row. I'm curious, how many pediatricians are there in Montgomery County, Mr. O'Donnell? Or Dr.
This is my report. It was 112 that was reported to me this morning, Council President Hucker.
Yeah, no, thank you. 112 out of how many is the total? I'm just curious. Do we know?
I'll look up that number to get it for you. I thought it was in the range of about 130.
Oh, really? Okay. So it's very high percentage of the total.
Yeah. And so this is from the state data. I don't know if that includes every single private practice of pediatrician or if that is the larger group practices. So, and certainly some of the practices have upwards of 10,000 children that are covered by their practice. So there's some very, very large pediatrician practices in our county.
Right. Okay. Thank you. Council Vice President Albornoz.
Thanks, everyone. I think the Council President mentioned this feels like Groundhog Day, and
yeah,
it does a little bit. Just based on the numbers that Dr. Stoddard just shared with us, we know we're going to have a supply and demand issue for the first few weeks, and there will be a lot more demand of families wanting understandable access, especially based on the large percentage of families that sought the vaccination for our adolescent population. I think we can anticipate, while in other parts of the country the numbers may be a little bit lower, they're going to be high here. And there will not be enough vaccinations for the number of people looking for them. So inevitably, what will happen is that people will go wherever they can. They'll start with their pediatrician and their primary care provider. They can't get it there. They're going to look to the county. They can't get it through the county. They're going to look through, the private providers that are out there. And they're probably going to have all the irons in the fire at the same time until something hits. And so it is we need to stress to families that their children will receive the vaccination. It just may not be within those first few weeks. And as we had to be in the last time around, and as I've shared, I learned a long time ago, the word patience is rooted in the Latin word to suffer. It's hard, especially when you're concerned about the health of your children. But I think we need to make sure we underscore to our public to level set expectations that for the first few weeks, there will be more demand than there is supply, which then leads to equity and ensuring that those populations that have been the most disproportionately impacted have access to as many of the vaccinations as possible, both for moral reasons, but also for public health reasons. So I want to summarize what I understood, which is important, on the schools that we have identified as cluster locations. Makes all the sense in the world to identify clusters where we've had disproportionate levels of COVID. Those schools will operate hours at least on the weekends and on the weekday evenings as well. Could we clarify that really quickly before I continue my summary?
Yes.
So weekends and weekend evenings.
Yes, that's correct.
Some of those schools will be weekday evenings.
Okay, great. And there, if we can find a partner organization, a Mary Center for example, who is in a position to be able to assist the county in administering the vaccination, there's the possibility that it could also be given at the local elementary school, in addition to the middle school as well. Did I get that right?
Yes, and in fact, we working with MCPS, they have a memorandum of agreement already in place. At least for Holy Cross Hospital, I know they've been talking to some of the other clinics as well, so that they could provide those services on their properties. And that's one of the strategies we're using to again expand and be able to do this during the weekdays at these sites.
We are also, Councilmember Alberno's, working with partners that were in this process early on. Some of the folks that were working with Health Initiative Foundation with HIF to align their capacity and resources to do vaccinations as well. So I can't give you a full list of a current list of the partners right now that they're involved, but part of that is us doing that with an MOU with them, and then having to do what is necessary in the way of background clearances if they haven't already happened with MCPS for the staff that would be involved in the schools.
So Dr. Carl, just
and then the last piece I'll add is that there is as we go forward with this, we're looking now, and the information you've seen is about our efforts to do a massive, large-scale rollout, and we will be all hands on deck in every place we can to do that, subject to the availability of doses. But beyond that, we have partners that will hopefully have access to vaccine that will go and do what we did the first time, which is take it to communities where there is a need and where they are hard to reach and where they may not have adequate access. So all of that will be in play as we go forward.
So Dr. Kroll, just to add to that, I do have the list, and I think that we should note and thank the partners. So I'm going to go run down the list. Holy Cross, all of our Montgomery Cares partners, we did an extensive query on their capability to provide pediatric vaccinations, such as what Council Vice President Alberno's indicated: Mary Center, Mobile Med, CCACC, Angarai, Kaiser Permanente, MCCPT, MCPS, HHS, NCCF, Evermind, Cheer, and those are the list of partners that have supported us thus far, but it's not inclusive of all the partners who have supported us or continue to support, and names to be added to the list.
Thank you. I appreciate that. So I do think, the slides are great. The decks are awesome that update us on general information. But given that we know there's going to be a supply and demand issue, and there will be urgency among families to figure out how to navigate this, I think we can go back and, as you've all already acknowledged, use some of those lessons learned to provide a very clear and simple steps 1, 2, and 3 on where families can go, and a reasonable time frame to expect the complete rollout of those vaccinations, which I know is a little challenging because we're at the mercy of what the federal government gives to the state and what the state gives to the counties. But just to make sure people are aware that they're in the queue, there will be options for them. I think will be really helpful and alleviate some of the stress and concern and confusion that we know is on the horizon. So that's one point. This just a couple of other verifications. So great news that the numbers are where they are, and we will be able to, as early as this Friday morning, eliminate the mask mandate. But again, acknowledging that the federal requirement is that it still be utilized in planes, trains, and automobiles, and that it also, per the state, will continue to be a requirement within our schools. And obviously hospitals and those areas in which we have a disproportionate number of vulnerable populations will also continue to be required to wear the mask per state and federal guidelines. I also want to confirm businesses are still permitted to require mask use if they should so choose, which is certainly understandable depending on the business. Wanted to confirm that as well.
That's 100% correct. Businesses can continue to require face coverings as they wish. The other thing I would say is we all, once the face covering mandate is lifted, we all probably need to show a little bit of grace and think about there will be people who choose not to wear masks. There will be people who choose to wear masks, and we should allow them both to operate within that environment as required. If there is a business that requires, we ask the residents who are patrons of that business to follow the guidelines and requirements of the business. And, that's it. You know, at the point when the mandate's lifted, it becomes a personal responsibility and personal choice matter, and we should all respect everyone's choices.
And so Councilmember Albanos, just to add to that, but let me back up. Please add to that list. They've been very instrumental, as well as our other minority health initiative partners. Our Saluti Bene Star organizations have been with us and administering vaccines and supporting testing. So they're part of that list of health initiative fund participants. I have not received any additional word. I did check yesterday with Dr. Chan, the Deputy Secretary of Health, regarding any additional guidelines and updates. So the mask, indoor mask mandates that were set forth by the Maryland State Department of Education, or any of those indoor federal regulations that pertain to transportation or other areas, as noted by the feds, are still in place. Once I receive, or if I receive notification, I will send it out to the council that these regulations have since been amended or changed, but they are still in effect.
Great. I think that's it for now. I'll have questions specifically for MCPS. We haven't even gotten to their presentation yet, so I'll yield back to you, Mr. President, so we can get back in the queue.
Thank you. We'll, yeah, we should move quickly because Mr. DeAndre has got to go in less than an hour. Councilmember Novato.
Thank you, Mr. President. I'll be very brief. First, I want to thank the team here, because what I heard in terms of this presentation, it looks to me like they are definitely capitalizing on everything we did early on, and really leveraging the network that we have in place. And so I really appreciate that the partnership with MCPS is very important. The slide that shows exactly where you're targeting the clinics, taking into consideration the issue of equity, I think was very important. The only question I have, which I'm sure MCPS could chime in when they do their presentation, is the issue of transportation, and whether there are opportunities to, instead of having to bring families, et cetera, to the school, will there be opportunities, maybe if there are like after school activities or things like that, where parents perhaps can consent, or however that works. But once you have them in the building, it's so much easier than trying to bring everybody back at some point. So just curious about that conversation, but very mindful of the whole notion of equity as it relates to the fact that there would be so many parents that will not be necessarily able to try to seek all of those different venues to try to get their children vaccinated, and the responsibility that we all have to ensure that we make it as accessible as possible to them. That would be really important. As Dr. Bridgers mentioned, we have these extraordinary initiatives that we stood up and we funded, and they helped deliver the numbers that we have today. So absolutely engaging them early on, it's going to be super important. But I don't have much more to say other than, really appreciate this team. This is not our first rodeo. We know how, chaotic this will be at the very beginning. We understand where the issues are going to be, and I have full faith in all of you to be able to stand up a similar system so we can get our youngest and most important treasures, our children, vaccinated as well. So when MCPS does their presentation, if you can address some of the possibilities that you have thought about, identified, or maybe would like to pursue to alleviate this issue of transportation challenges, which we know are significant, especially in some parts of our county, like the East County, for example. Thank you.
Thank you. Councilmember Glass.
Thank you, Mr. President. So I just want to, before I get to the equity part, I just want to say that I appreciated the presentation, particularly regarding the outreach efforts and some of the creative thinking. And I love the superhero squad and the graphics and the cartoons and the level of engagement there. And as I understood that, not only is the superhero squad, meant to encourage, help kids become more comfortable with getting vaccinations, but also encourage parents to vaccinate their kids. Although I think, quite frankly, with the incredible, nearly universal vaccination rate that we have for adults, I don't think it will be much of a lift to get them to get their kids vaccinated. I think they will likely already be there based on their own behavior. But as everyone has been saying this morning, we need to have an equitable rollout so that those who want it are able to get it. And my concern, similar concern as to my colleagues, but my concern is with the single parents and the parents who are working multiple jobs, many of whom required additional outreach and support to get themselves vaccinated. And now we're asking them to get their children vaccinated, and we need to make it as seamless as possible. And that is why we're making all of these suggestions, from in school, from making the transportation accessible, whatever we can do to ease the burden for those who already try to find 5 minutes for themselves. Now we're asking them to do more and protect their kids and the broader community. And so we are pushing you because we need to make sure this is as easy as possible for everybody. And I know you understand that. I've been listening to everybody's comments, and the creative thinking, or scratch that, it is not creative thinking. It's actually obvious thinking of making sure that, you know, schools like New Hampshire Estates and Gaithersburg Elementary schools in the communities that need our direct outreach and support have as much of it as possible. Because we don't want to go through a Groundhog Day. We want to nip this in the bud and get this right 1 year after we started these efforts, almost 1 year after we started these efforts. So if there's anything that we've learned from the vaccination of adults, we need to apply that to the vaccination of our kids. And I know that you will all take that into consideration and to your planning. I yield back, Mr. President, so that we can move forward and hear from MCPS as well after our colleagues. So thank you.
Thank you, Councilmember Katz.
Thank you very much, Mr. President, and thank you to all on this call. As always, we sincerely appreciate everything you're doing. I am the proud owner of a Moderna booster as of Saturday. I went to Montgomery College, Germantown, and it was perfect. It really was, with the one exception, because my appointment was at 9:05 on Saturday morning. They had to wait to download the software on Moderna from the state. And if it took, I don't know if it took 10 minutes, but people were friendly. I've been to cocktail parties that were not that nice. I can tell you, it was an enjoyable experience, and I encourage everyone to do it. I am confused, and I've gotten conflicting information on when you should get the flu shot. There are people that says you can get them both the same day. There are people say you should wait 2 weeks in between. When should someone get the flu shot if they are getting a booster?
So Councilmember Cash, thank you for that. I actually, about 3 weeks ago, and I have it somewhere in the voluminous paper stack that I have that I carry around daily in my folder. But according to CDC, you can actually get the flu shot at the same time, and in some practices, the same time that you visit your primary care physician. The only caveat is that based on CDC recommendation, is that you don't receive it in the same site. That is an inch above or below where you receive your COVID vaccination or any other vaccine. One of the strategies that literature and information indicated that often pediatricians or prescribers or doctors in general will administer multiple vaccines at the site or when an individual comes to get that vaccine, so that they can come and get all the vaccines at the same time. So for example, if you require a flu shot, or you require a single shot, or you require a pneumonia shot, more often you will receive all those shots when you visit your primary care physician. So that's the information that I have. If there's some additional adjustments, there's no clear-cut guidance in the clinical information that we received on Friday, but I pulled that information from CDC's website. I can share it with you if necessary in a separate cover, but that's what I read 4 weeks ago.
Okay, and I accept that as well. Thank you very much. And I am confused on when the mask mandate would be lifted. If it's the first day that we got the moderate level was last Thursday, correct?
Yes.
So when you said it would be 12:01, are you saying that it's 12:01 a.m. on Thursday that it's lifted? Or are you saying that we go through the entire day on Thursday and it's lifted?
So my recommendation was based on legal counsel advice that I received based on previous Board of Health regulations. So that indicated that the initial day is actually 0 day, if you will. So the following day, Friday, would constitute day one. And so the mask mandate would end at 12:01 Friday morning. If in fact, based on our conversation and extensive conversations we've had, or I've had with Councilmember Friedson and Dr. Stoddard, if that initial transmission day, based on the Board of Health regulation, started on Thursday, which would day one, it would end at 12:01 this Thursday. That's why I asked the council, please share your intent based on the Board of Health regulation. If it's Thursday at 12:01 or Friday at 12:01, I cannot overly express the recommendation that continues to be set forth for moderate to low levels of transmission, especially for those individuals who are unvaccinated. It is a recommendation strongly recommended by CDC, and we've had conversations about CDC and using their metrics, that those individuals continue to wear a mask indoors. And so that is the ongoing recommendation. So at the Board of Health, or as the council sitting as a Board of Health, if it's the will of the Board of Health based on their intent, it will either be Thursday or Friday once we conclude this.
Let me weigh, thank you, Doctor. Let me weigh in. I believe it should end at 12:01 on Thursday. A week is 7 days. There's only one Thursday in each week. And this one started on Thursday. Thank goodness. It started last Thursday. And I believe that we have gotten there Thursday in our 7 days. And if things continue the way they are, I'm one person that believes it should end at 12:01 a.m. on Thursday. And I appreciate everything everybody has done. And thank you very, very much. The only reason we're here at this point that we even are having these discussions is because of all of your fine work. So thank you very much.
All true. So we happen to be the Board of Health here. Is there any objection to 12:01 on Thursday? Okay. There we go. Well done, Councilmember Katz and Councilmember Friedson. Okay, that is. Are you finished, Councilmember Katz? Was that your final?
Yes, I put myself on mute. Thank you very much.
Great. Okay, that is everybody for HHS. Thanks so much for your great presentation, Mr. Dandry. I know everybody has other stuff on their calendar, but we want to get through yours and let you get to your next appointment. Floor is yours.
Good morning, President Hucker and council members. Thank you very much for this opportunity. As many of you are probably aware, next Tuesday afternoon, there's an opportunity for a longer MCPS update at the council meeting regarding our COVID-19 response. So next Tuesday, we'll be sharing information about the academic impact and how we are mitigating learning disruption. And then we'll also provide detailed updates during that time next Tuesday on each of the 5 points in Dr. McKnight's 5-point COVID-19 plan. So as a result, today I'm going to be very brief, and I do apologize. As President Hucker mentioned, we have a Board of Education meeting today, and so that's why there was a time constraint for the presentation this morning. And then Ms. Navarro, I also made a note that we will make sure to address the transportation challenges when we come next Tuesday afternoon to talk in more detail.
We don't want the Board of Ed mad at us, for sure. So, go.
All right, so what I'm going to now just share briefly is a couple of updates and then share the data points that we have been asked to share at each of our biweekly briefings. I do want to start by just talking briefly about the COVID-19 dashboard. I know I referred to this at our presentation on October 12th. And as I noted, after it was initially posted, it became apparent that there were discrepancies between the number of cases that were reflected in the community letters that were posted on our website versus the number of cases that were reflected on the dashboard. And so as a result, on October 5th, we removed the dashboard and then manually reviewed every letter and every case on the dashboard. The dashboard was then reposted on Thursday, October 14th, and it's now updated once per week with the data from the previous week after we can review and make sure that everything is accurate. As a result of that comprehensive review, we did have to make some corrections to our weekly data regarding positive cases and the number of students entering quarantine. And so when we look at the data today, you will see there have been some adjustments based on the additional information that came out of that review. And then we put additional processes in place to make sure that our data monitoring captures all the information that we need moving forward. I do want to start by just briefly mentioning, as we have in the past, an update on our screening testing. As you may recall, the state of Maryland provides screening testing opportunities to all school systems where they can opt in and use a state vendor to provide screening testing for asymptomatic students in schools across the district. And so schools in the program, ultimately, a percentage of the students whose families have consented for testing are then selected on a weekly basis and participate in the testing. So as of the end of last week, we're up to 180 schools where this is currently occurring. We have collected almost 45,000 consent forms, and we are continuing to work on that. It is important to note, as a side note, when we talk about rapid testing that's occurring in school health rooms, we can get consent on the spot. So just because a family has not submitted a consent form does not provide a barrier for the symptomatic student rapid testing. But in this case, we're referring specifically to the asymptomatic screening testing. Since the beginning of the year, there have been 32 positive tests that have been identified through this testing program. And we have been a little bit delayed in getting this rolled out to all 209 school sites as a result of some constraints with the vendor. But we are right now almost there. And so we're expecting that this will be in all schools by the end of next week. So the next piece of data that we've been looking at is the information on positive cases by week. And as I mentioned, for the slides that you're going to see for the next couple of minutes, these have been updated to reflect any discrepancies that were identified, needed to be corrected between what was posted on the letters on the website versus the dashboard. And so here you will see in the far left column each week of the school year so far, then the number of student cases that were reported that week and the number of staff cases that were reported that week. And as you can see, there was, as we mentioned at the previous meeting, a spike that during the third week of school that possibly we believe could be attributed to the 4-day weekend that happened the week before. And then since that time, the numbers have gone down through the rest of September and then stabilized during the month of October. So each week, so far this month, we've had approximately 50 to 60 student cases that have been reported each week, and the number of staff cases have been in the teens. The second piece of data that we've spent time looking at each of these update briefings is regarding the number of individuals who are entering quarantine by week. And again, this data has been adjusted to reflect any discrepancies that were identified in that review when we looked at the data for the COVID-19 dashboard. And so, as you can see from the first week of the school year, when we had more than 2,000 students entering quarantine until this past week, there's been a significant reduction in the number of students entering quarantine. For this past week, the week of October 16th through 22nd, there were a total of 332 students who were identified as close contacts of positive cases who entered quarantine. And huge thanks to DHHS for their partnership in working with all of our schools to take as many steps as possible to reduce the number of students who are entering quarantine. I do just want to highlight a couple of pieces of information that I've shared previously, but help to address where you see some significant changes in the data. So to start with, if you look at the column on the far right, it's entitled Close Contacts of Symptomatic Individuals. As you may recall, during the first 2 weeks of school, we were quarantining close contacts of students who had one or more COVID-19 symptoms in accordance with the guidance we were receiving from DHHS at the time. We worked closely with DHHS, and ultimately that was changed. And so as a result, after the second week of school, that's why there are zeros in that column the rest of the way down. The other significant change you will notice is between the third and the fourth week of school. So highlighted in pink, you'll notice that there were 1,219 individuals who entered quarantine during the third week of school. That is also the week of the school year when DHHS started to implement rapid testing in school health rooms for all students who were showing symptoms at school. And as a result of those rapid tests, it was possible to then identify on the spot whether or not a student truly had COVID-19. And as a result of that, in many situations, students did not test positive. And so the number of close contacts who needed quarantine was significantly reduced. And so the number went down by almost 800 from the third week to the fourth week. And since that time, numbers have been relatively stable, although this past week obviously was our lowest so far. And we're hopeful with a variety of other things that are being put into place to continue to work to keep that number as low as possible, because as we said, repeatedly, our goal is first and foremost to keep students safe, but to make sure that our students have the opportunity to be in school and learn on a daily basis, because we know that in-person learning ultimately is what's best. And so, as I mentioned at the beginning, we will be sharing a lot more details next Tuesday, since we have an extended time for MCPS to share. But this is just a highlight of the data that we've been asked to share every other week, as well as a couple of other updates. So at this time, I can take any questions that you have.
Council Chairman Rice.
Well, thank you very much. And thank you, Mr. DeAndrea, for this information. I just want to say congratulations, first and foremost, because I think it's great that we're starting to see a reduction in terms of the number of students who are made to quarantine and can continue with their education. I know that's been a priority of MCPS. It's been a priority of this council. It's been a priority of parents all across the county to try and keep our kids in school. And, working collectively and collaboratively together, we've seen those numbers continuously decline in terms of those numbers of students who need to be quarantined. So I think that's fantastic. I think it's also indicative of the fact that many of our students have been vaccinated, as well as their families have been vaccinated. So the same successes we saw in the previous presentation from DHHS is certainly transposed into the data that we see here. And it's one in which I think that once we get our 5 to 11-year-old students vaccinated, we'll continue to see those numbers continue to decline. So it's great news to see. And so I just want to say thank you for that. I did just want to ask what some of the challenges are, because I do see with consent forms, and that was one of the things that I really wanted to stress at the beginning when we put out those consent forms. I'm one of the 44,569, one of the parents who filled that out for my daughter, who's at Northwest High School. We filled out our consent form when it came out, but do want to understand, have we heard from parents about some of the concerns they have about filling out the consent forms? What seems to be some of the stumbling blocks? Because with everything else being successful, it seems as though, and Councilmember Glass alluded to this earlier in his comments, with how successful we are at getting folks vaccinated, it's just interesting that this is tending to lag behind those kind of numbers. So we see ourselves vaccinated at high levels. We see our children vaccinated at high levels for those that are eligible. But then when it comes to the consent forms for rapid testing, it seems as though we're lagging. So what are we hearing from folks?
So this is something that we are definitely continuing to work on. It is important to note that the consent forms are for both rapid testing and for screening testing. And if a student is symptomatic and goes to the health room during the school day, ultimately, the school health room staff will call, get permission, and then get the consent form filled out afterwards so that we can move forward with doing that rapid test. So we've heard a couple of different things. It is also important to note initially we were very focused on elementary, and just recently started to be focused on secondary. So I think that's definitely one piece of the puzzle. And we have also heard from families a couple of different things. One, there have been some families that have expressed concern about students being pulled out of class to participate in the screening testing on a weekly basis. And then we've also heard some concerns from families that we've talked through with our vendor about if a student has had, and this is a smaller number, but it's definitely been something we've heard, if a student has had coronavirus in the past 90 days, then they should not be tested based on what the families and what the information that we received. And so that's been one other piece. I would say the biggest one is about the missing the students being pulled out of class for the testing. So in any case, we are definitely continuing to look creatively at how we can continue to increase that number. And it is important to just reiterate that it doesn't prevent us from moving forward with rapid tests for symptomatic students, which are so critical.
Absolutely. And I would just suggest that, again, if there are ways in which we can try and minimize that impact on the school day and school learning, I do completely understand, especially when it comes to our secondary students. There's just so much that's compacted. You were at Northwest as principal. So much is compacted into the day that I do understand concerns for parents as well as students who may just not want to say that, look, this time is incredibly valuable. Even though your health is incredibly valuable too, but, I can't miss this test or I can't miss this assignment. We're going into, exams that are coming up, those kinds of things. So the ways in which we can look at hours. And so again, working with our Department of Health and Human Services, whatever we can try and do to alleviate those kinds of situations, I think would be great. So as we see some of the stumbling blocks that are in our way, if we can try and come up with creative solutions, working together with our Department of Health and Human Services and those nurses and the contractors who are going to be administering those tests, ways in which we can get around that, that would be terrific. But again, just want to close by saying congratulations on the numbers. The numbers are definitely trending in the right direction. That bodes very well for us. And just want to say thank you to all the partners involved.
Thank you, Councilmember Rice. And just to address one other point about the testing, we have had conversations with the vendor about what we can do to try to minimize the impact. It is important to note this is through a state program, so it goes directly between the school system and the State Department of Education. So these tests are not being administered by DHHS staff for the screening program.
Thank you. Thank you, Council President.
Thanks, Councilmember Joanda.
Thank you, Mr. President. Thank you to Dr. Kroll, Dr. Bridgers, the team, Mr. DeAndrea. Really appreciate all the work. You know, as I hope Dr. Bridgers is still with us. You know, as I'm sure all my colleagues will get your email in the morning, and it's one of the, it's the second thing I usually do is look at your email. And this was a great day, seeing that we had the lowest case rate and the lowest transmission rate in the state of Maryland. And I think it's just a testament to all the work that we've all done collectively and our residents have done, as has been mentioned before. So just want to thank you for all the work you're doing. I know it's a fluid process. It continues to be a fluid process. We're here at Groundhog Day talking about not enough vaccine, as was mentioned, but we're going to get through it. I just have one question on the school side. Many of my questions have been asked. And this is for probably Mr. DeAndrea and Dr. Stoddard. You and I have talked about this earlier in the week. Where are we on the test to stay option? While it's great news that we're down to 300 plus students that are quarantining, I know we had been working on implementing a test to stay option even for that population. I thought it was going to happen this week. I'm not sure if it did. Can you give me an update? Can you give us an update on that?
Absolutely, I'm definitely happy to. And then Dr. Stoddard, feel free to jump in. So DHHS has been, incredible to work with in working to put together this test to stay program. And so, as Dr. Stoddard, I believe, mentioned briefly at the beginning, you will be hearing more information later this week, but we are prepared to start a very small pilot in the coming days this week.
Okay.
The only thing I would add to that is we also provided guidance on test to stay to our non-public schools on Friday, so that they also may consider developing their own programs for review. We're going to use our letter of approval team. You heard the LOA team being used before. We'll review with Dr. Bridgers and the team from HHS the protocols that come in from our non-public schools as well. So as Mr. DeAndrea said, coming days, and you will see a formal announcement about it later this week.
Okay, and that will contour to the normal, what people think of as test to stay. You're identified, but you can take this test and be able to stay in the class and not be. And when you say pilot, how large of a scale are we talking about here?
I think the first week we're going to try and do a couple or a few schools just to try and test it. But we're going to preferentially target schools where larger populations of students are identified, or full classroom quarantines, meaning 15 plus students, or in a smaller classroom, the full classroom is identified as, for example, if some of our Title I schools have smaller classroom size, we don't want to obviously eliminate them based on their right. So it's full classrooms or 15 plus. That way, even a few schools could reduce that quarantine number that Mr. DeAndrea showed you by 30 plus. So we'll start with that this week. And then once we see that works, we have the resources we believe to be able to look in the future weeks to expand it.
And obviously, good as we head towards this marker of getting our younger children vaccinated, that'll help as well. So, okay. Really appreciate that. And again, thank you for all the work you all are doing. Thank you, Mr. President.
Thank you. Can I just follow up? I'm just looking at the dashboard. I'm confused on, maybe it's the nomenclature, but it shows for October 14 staff and 34 staff, 115 students under total, in the bar graph, total staff cases and total student cases. But then below that, it has 0 active cases, staff plus student.
I don't have the dashboard up in front of me at the moment. I will definitely check on that as soon as we get off.
Right.
And follow up with your office. Ultimately, it is important to note as one way to make sure that we're putting out accurate data. I don't believe, and Mr. Blinsky, you can correct me if I'm wrong, the data from last week has been added into the dashboard at this point yet.
It's the, the teal boxes below the histogram has 0 active cases, and then it just has a hyphen dash for active quarantines. So those can't be right, obviously, given what you have in the graph.
It could be that something is not calculating, is not loading correctly this morning. I will
Right.
follow up on that as soon as we get off.
Right, I figured. Okay, Councilmember Reamer, thank you.
Thank you. Quick question. Sorry, I don't know the answer off the top of my head, but is it a 7-day average of moderate transmission for the mask requirement to be lifted, or is it 7 days consecutive moderate transmission?
7 consecutive days. Thank you for that question, Councilmember Reamer. It's 7 consecutive days from the notification using CDC's metrics that we've reached a moderate transmission threshold, which is 10 through 49.99 cases.
Okay, did I miss something? But I thought today we were over 50 cases.
It's not a daily, it's not a daily calculation. It's a 7-day.
7-day average.
It's a cumulative total for 7 days, which is what defines moderate transmission.
Correct.
And so it's actually about 525 cases over a 7-day period for Montgomery County cumulatively. So, that averages out to about 75 cases a day if you did the math on that. So we've actually had a couple of days over last week that we've been above 75.
Right.
And we've had so many below 75 that when you do that average is how it works out. This isn't the favorite metric that CDC has utilized to do things with, but it is the metric they recommended, which is why we recommended it formally.
It's fine. I just wanted to make sure we weren't missing today's data for some reason, which I didn't think we were, but okay, great. Could you say again, I'm having really bad connectivity issues on the Wi-Fi, so it's been hard to follow some of this, but how many, with the Test to Stay program, you were hiring, I think you had said initially 60, but then as many as 100 employees to implement the program. Can you update us, if you haven't already, on where you are in that progress and what the timeline will be to take the program, to a bigger scale?
I don't know if Dr. Kroll is still on or Dr. Bridges wanted to start.
Sure. I'll jump in and Dr. Kroll can add to it. So we had, thank you again, Councilmember Raymond, for that question. So we looked at a phased approach working with MCPS where we would get not only relief added to our school health nurses, but our school health room techs. So we looked at 60, they were incrementally identified in phase 1. So to date, we've engaged and brought on 46 contractual staff and MCPS schools.
Yeah, I couldn't hear that number. I'm so sorry. I glitched right when you said the number.
In phase 1. So we have 46 contractual staff on board now to support our school health services, which include rapid testing and support in that effort. That's phase 1. All of these schools were identified as schools where we needed the most relief. We're entering in phase 2 now, where we have approximately 25 schools, and I'm looking real time at the data feed that I received this morning prior to the Board of Council sitting as a Board of Health. We have 25 schools, and we're onboarding staff now. Part of that onboarding for that staff, a strike team, a team, if you will, of 2 to 3 individuals will be identified to support. It may be 4 if we identify those schools which were the target. So we've carved out those individuals. Our goal is to staff as many as possible, which could be up to 100, but it's an iterative process based on our phased approach. But we are moving very actively to get those staff on board, which includes credential notification, ID checks, et cetera, because they will be in our MCPS school systems, and we need to keep the system safe.
And these are staff that will travel from school to school.
Correct. For the mobile teams, for the Test to Stay pilot.
Right.
Again, we're going to start small. We're going to look at the efficacy of it to make sure that it's working, to see if we need any tweaks. We started at identifying cases where there were 15 or more or entire classroom. in an elementary school setting, because we know that our elementary school kids are unvaccinated. And so we're looking at those schools. These teams will be able to move either through a particular region or within a cluster. That is the intent.
Exactly. So after our elementary school vaccination, after students become eligible, how is that going to change how you handle these incidents? Are you going to know which students are vaccinated in the room, and then the quarantine policy will change appropriately? I guess you wouldn't necessarily. Where will we be 3 weeks from now, after a month from now, after we've gotten a fair amount of students vaccinated?
So we will continue to monitor the outbreaks. We will continue to have those measures in place. Again, the test to stay pilot is yet another means modification of the quarantine process to keep those asymptomatic students in school as opposed to them going home. So we will continue to monitor that. We anticipate that it may drop off some, but we will still have the capacity and capability in place. I've often mentioned the guidance from MSDE and MDH. They're actually working on quarantine guidance that may look at where the respective jurisdictions are now as far as their quarantine process or processes, I should say. The test to stay pilot was one option once that guidance comes forward. But again, we're not waiting on the guidance. We're looking at what's beneficial and applicable to our community, to our school age kids settings for those individuals who are unvaccinated, and we will begin the pilot. We did send our pilot protocol to MDH for their review and recommendation, MDH and MSDE, and so we're ready to begin. As soon as we get those resources, hopefully this week, we can begin to identify those schools. We will work with MCPS, which is what we've done, to identify those spaces where we need to quarantine or have an alternate strategy incorporated. And so this is our way forward.
If I can just add.
Go ahead,
Dr. Stoddard.
No, I was just going to say, we're already doing what distinguishing already, right? Because we obviously have grades like 7th grade where there are some students who are eligible to be vaccinated and some students who are not yet eligible because of their age when they start. Same is true in 6th grade. And so we are already, through the contact tracing process, being able to distinguish between fully vaccinated students and unvaccinated students is for the purposes of quarantine.
And I was going to say,
I would just add to that excuse me, that to bear in mind that as we start to vaccinate young children, it is, I believe, the vaccine is a 2-dose vaccination process, which means that they will not be fully vaccinated after they've gotten that second dose. So our procedure as it stands now would likely be in place for some weeks to come until we've got folks who are fully vaccinated in that age range. Sorry, Jimmy. Mr. DeAndre, please go ahead.
No, I was just going to say what Dr. Stoddard shared. It'll be very similar to what we do in, the upper grades of middle school and high school currently, in terms of, having conversations. We are looking at ways to possibly collect and gather all that data. So we've got the information, but at the current time, we work with students and families to determine if someone has been vaccinated, and then obviously they don't need to quarantine if they're close contact.
Thank you.
Thank you. Councilmember Friedson.
Thank you, Council President. Thank you to colleagues, and thank you to everybody for your work here. We're making a lot of progress. We've got a lot more progress to make, certainly, and hopefully 5 to 11-year-olds can be vaccinated sooner rather than later, since that is directly tied to this conversation, as Dr. Kroll just noted. The more doses we get faster from our state partners and with our outside partners, the better off we're all going to be. Just wanted to check, there's still a lot of conversation about the really big quarantines. And I know that has been significantly reduced. There's been a lot of improvement there. But is there any support that DHHS is providing or plans to provide to MCPS when, quarantine reaches a certain level, whether it be a full grade or, multiple classrooms, or, is there a threshold at which DHHS is providing support? I know you're providing support on a regular basis, but some type of secondary review or anything in that nature?
So I would say that we can Go ahead, Jimmy.
Go ahead, Dr.
You
Kroll.
go first. Nah, you first, by all means.
I was just going to say, to jump in very quickly on that, in most cases, as a result of the work that has occurred in partnership with the HHS, in most cases when we've had larger quarantines in recent days, it's been a result of a teacher or a staff member who has been testing positive. And then ultimately, one of the goals of Test to Stay is to be able to focus on the larger quarantines that we have. So I think that in the coming days, that will continue to help to address the situation.
Right. So I think what the larger quarantines, what we're seeing now is fairly typical. Small numbers of cases, of positive cases, and numbers of students that are sent home in any school. On occasion, and on at least one occasion, we've seen a large number of cases that were symptomatic and sent home, and resulting in some potential quarantines. What's important, and I want to just talk about the relationship between rapid test and Test to Stay. What's important for us around this is that rapid test has clearly been a game changer for the vast majority of students that might have otherwise been quarantined in this process. Those 16,000, 1,700 students you saw in the first week dropped dramatically as soon as we introduced rapid testing. We were able to stand that up. That came at a cost, and we've talked about the cost in terms of stress to the staff and capacity of the staff, of our school health staff, and the addition of our contractual teams to come in and do Test to Stay, or rapid test. Adding Test to Stay to that is a way of dealing with those small pockets of students, those small clusters where there may be schools that are closed down, and Test to Stay is our primary response, will be our primary response to that. We cannot sacrifice rapid test for Test to Stay. It's important that we maintain that balance, because if we start going immediately to rapid test, we will have far many more students that will end up being quarantined if we do anything that damages rapid test response. So it is a balancing act to try to expand our capacity so that we can maintain rapid test and expand Test to Stay over time, so that we can get to as many places as possible. Right now, that rapid test is targeted, and as we've developed it, strike teams that will respond to schools that have larger numbers of folks who have been quarantined due to exposure, who are unvaccinated. That is likely to be the strategy that we deploy for the foreseeable future around this. It is unlikely that we will have capacity until we get many more students vaccinated, capacity to do Test to Stay in places where there are very small levels of exposure.
Got it. So, because part of the Test to Stay is, the larger the group of impacted, the harder it is to implement Test to Stay. So these two dynamics really go closely together. And I'm just really repeating what you've already said, just for my own understanding and for everybody else, those of us who know a lot less than you know. But if the group is too large, the Test to Stay becomes too burdensome, and you don't have the staff resources to do that. So we have to make sure that the contacts and the way that we're defining that and the way that we're keeping students naturally apart from one another is at a point that it is manageable, so that when we do employ Test to Stay, that we actually have the capacity to get it done. And so I think that's something that I know you're working on, that I hope that we can continue to be updated on how that's going, because if we can't get those groups to be managed to a level that is doable, so to speak, then the Test to Stay regimen that you're looking to implement can't be done in a way that doesn't jeopardize the other activities that you have, rapid testing being first and foremost among them. Is that accurate?
That's right. I thank you for the opportunity to borrow a phrase from one of our former colleagues, level set this around Test to Stay. It is important to know that we're starting a pilot now. There are bugs and pieces that have to get worked out to make sure we can do this effectively and efficiently. And that's part of what Mr. DeAndrea is talking about in terms of getting started this week, and then expanding out as we build up more staff and we get a clearer process of how fast and how quickly and what the logistics are of making this happen. Things like, we'll get notice, for example, just for a rough example of a classroom that looks like it's going to be closed, or an exposure where there are going to be 20 cases. We'll get that today. That means that between the time we get that notification and tomorrow, we have to figure out how many of those students are going to sign up for Test to Stay, are ready for Test to Stay. How do we get a team in place? How do we get the tests there? How do we set up spaces where they can be tested and get them into school, tested, and into classrooms if positive, if negative, and if they're positive, then what do we do in terms of how we get students back into full quarantine if they test positive? So all that is sort of the nuts and bolts that we're working out with the MCPS in this pilot that we want to get right before we get too deep into expanding this.
Understand that. Last question here. I heard you loud and clear earlier in your point about 5 to 11-year-olds and changing some of the guidelines that they're not fully vaccinated until they've received their second dose. And so it's not just the first go around, which we don't even know how many doses we're going to have. We hope we have, enough to meet the needs and to fulfill our capacity, which seems like it's going to be much more than what we're going to receive, at least in the first wave. But at what point will those guidelines be relooked at? Is there a certain percentage of 5 to 11-year-olds that would need to be fully vaccinated before a quarantine policy is looked at? Are we waiting for guidance from the CDC on that? Is that something that we expect from them? Are we developing that ourselves? Is that something that the State Department of Education and the State Health Department are providing input? How is that process going to work?
So our current policy around this in terms of schools and quarantine is that we are not quarantining vaccinated students. It is unvaccinated students that are at greatest risk, and so that's where the quarantine rule comes into effect. So as students become vaccinated, that changes it will automatically change the number of folks who are subject to immediate quarantine.
Got it. So really important point. The guidelines won't necessarily have to change. The data point of the number of students who are vaccinated, particularly elementary school and early middle school students, is going to dramatically change, we expect and hope. And that is what's going to significantly change the quarantine policy, not what the policy is, but how it's implemented just by virtue of 5 to 11-year-olds. Is that correct?
It should, yes. Given time, it will impact the number of students who are at risk of needing to be quarantined.
Great. Okay. Well, that's clear and understandable. I think easy to communicate to parents. So appreciate you clarifying that.
Councilmember, if I may, one additional clarification I think is important. So obviously it's your 2 doses plus 2 weeks is the CDC definition of fully vaccinated. So thinking about Pfizer being a minimum 3 weeks between doses, the earliest possible time that a person could become eligible to, be fully vaccinated after the 5 to 11-year-old launch is 5 weeks after. So 1 dose, 3 weeks before the second dose, then 2 weeks after that for their fully vaccinated. So that's the earliest. The first person who's vaccinated, the soonest they could be fully vaccinated and therefore not have to quarantine is 5 weeks post whatever the launch day is.
And to your point, it's really important that the 5 to 11-year-olds be vaccinated, because when they come back from the holidays to school after the break, that's when all of us are really concerned about the risk to young people in congregate settings in school. And so if lots of them are vaccinated, the vast majority of them are vaccinated by the end of the calendar year, fully vaccinated after the 2 weeks after the second dose, it will dramatically impact the spread of COVID and where we are at that point. So thank you very much. Appreciate it, Mr. President. And thank you to all of you for your work.
If I may, Mr. President, just very quickly, Councilmember Friedson, and this has been a practice to which my family saw it directly with my daughter. And I said this at the very beginning. At the very beginning of the school year, we had a positive COVID case in her classroom. When they did the contact tracing, contact tracer called, asked for the data in terms of when Kaylin had been vaccinated, all those kinds of things, and determined that she was then therefore eligible to return to class and would not need to quarantine. That's with the direct positive case in the classroom. So that's what our schools have been doing with our older kids who were already eligible for the vaccine, who got vaccinated over this summer. And so that's why, again, I just want to stress again, if folks are concerned about their kids entering into quarantine and missing school, please get your child vaccinated, because it automatically means that they're going to continue on with their matriculation in school. Don't have to worry about testing, even though we made her get tested just to be safe. But again, it keeps all of those things from happening. It significantly reduces the numbers. And I saw it firsthand.
All right. Any other requests to speak, colleagues? Going once, going twice. Okay. And thank you so much, Mr. DeAndrea. Ms. Dublinsky, to anybody else on your team, anybody has anything else to add? If not, I think we're done with this item.
Thank you very much.
You bet. And you can still make the Board of Ed meeting. Give them all our best. And thank you so much for everything you're doing to keep our kids safe. We're looking forward to an updated plan, right, that includes a lot of elementary schools, I hope, because I'm pretty sure 5 to 11-year-olds go to elementary school still. Thank you. Thanks for everything you're doing. Really appreciate the update.
Thank you.
Thank you. Have a good day.
Everyone, get a flu shot.
Thanks, Dr. Bridgers. Thanks, Dr. Kroll. Thanks, Dr. Stoddard.
Stay safe, everyone.
All right, we are done with sitting as the Board of Health. We can now move back to the council. The next item, item 4, is action on an appointment to the Montgomery County Planning Board. Is there a motion to approve the appointment of Ms. Carol Rubin?
Mr. Council President, I am pleased to nominate Ms. Rubin today for the Montgomery County Planning Board. We had applications open and we received a number of really qualified individuals. We had an interview with several who were really outstanding. Ms. Rubin is so distinguished in her long career in service in planning to this county. And she is well known to us and admired by stakeholders in a lot of different sectors in the county. And we heard from advocates in the business community and the civic community and the planning community across the board. So I am pleased to nominate Ms. Rubin for a seat on the Montgomery County Planning Board and look very much forward to working with her in that capacity.
Councilmember Reamer has moved. Is there a second?
Second.
Councilmember Novato seconds. Any discussion? Ms. Rubin, welcome. It's great to see you. All those in favor of Ms. Rubin's nomination, please raise your hand. That is unanimous. It's a landslide. Ms. Rubin, congratulations. We are really looking forward to working with you in your new role. And we're very grateful for everything you've done for the county and can't wait to work with you as a commissioner.
Thank you. I'm overwhelmed. I'm very excited and I really appreciate that the faith that you have in me to carry forward this important role. And I really want to thank all of the people, the organizations, the individuals who wrote in, took their time to write in and support. And I'm just ready to get to work.
Excellent. Well, we're counting on you to get to work. There's a lot of work to be done. Thanks so much.
Thank you.
We'll see you again soon, but congratulations. We're very happy for you. All right, colleagues, we're right on time. Next, we can take up the consent calendar. Is there a motion to approve the consent calendar? Councilmember Reamer.
I would like to move the consent calendar, although I would also like to separate out one item and remove it and just not act on it today. And that is a nomination for the Washington Suburban Transit Commission. So I would like to move the items A through H as our consent calendar, and we can return to the topic of the appropriate nominee for that commission at a future session.
A through H. Is there a second? Councilmember Glass?
Second.
Great. Okay. So A through H have been moved. Councilmember Novato, did you wish to speak to any of those items?
Yes, I do. I want to request be added as a co-sponsor to item A, the special appropriations to the county government's FY22 operating budget, the guaranteed income non-departmental account, which is with the lead sponsors, Councilmember Joanda and Albornoz. I'd like to be added as a co-sponsor.
Terrific. That will be done. Councilmember Joanda.
Thank you. I'm glad Councilmember Navarro went first. Thank you, Councilmember Navarro. Just want to briefly say, we're going to talk more about this later. I want to thank all my colleagues, the co-sponsors, and particularly Councilmember Glass, Councilmember Rice, Reamer, Council President Hucker, Councilmember Navarro, but particularly Council Vice President Albornoz for his partnership on this. I'm really excited. We're really excited about this new program as part of our COVID recovery, and really look forward to working with all of you all to make sure this rolls out right and we support our residents and lay the groundwork for the future. So just really excited and appreciate the support. Thank you.
Okay, so items A through H have been moved and seconded. All those in favor, please raise your hand. And those, there we go. We're unanimous. That's all approved. We'll come back to item I at a later date, and we can now take recess till 1:30. Thank you, colleagues.